Rutherford County Risk Management and Insurance Committee meeting. First, before we get into approval of the minutes, I'd like to recognize Ms. Veronica Buchanan, our newest member. Veronica, glad to see you tonight. Hope you enjoyed last night. Long meeting, but thank you for coming on board with us. Without objection, we'll go ahead and get into the meeting and ask for an approval of the minutes. Is there a motion? Got a motion and a second. All in favor signify by saying aye. All opposed? Motion carries. Financials. Ms. Street.
Yes, sir. Thank you for that. And Ms. Buchanan, you'll be well immersed after this long meeting today as well. So if you show up next month, we know we made a good decision bringing you here. All right, so if we'll look at Fund 264, we'll look at the first page of the report, and we will see at the end of October, revenue came in at $6,891,000, with expenses coming in at $6,743,000. Page 2 of that report will show the calendar period, year-to-date revenue versus expenses. Our current revenue, $61,593,000, and our prior period was actually $54,296,000, with expenses in current period at $57,224,000, and prior period coming in at $56,920,000. From a fiscal period perspective, year-to-date, we are at $17,169,000 for revenue compared to prior period of $15,392,000. Our current expenses are at $24,198,000 compared to prior period of $22,699,000. Page 3 of the report is intended to give you additional information on a calendar year comparison from 2017 to 2018, as well as fiscal year comparison from 2017-18 to current fiscal year of 2018-19. Looking at the 2018 all-in, you can see that from a calendar year perspective, we are trending well with our revenue outpacing our expenses to the sum of $4.3 million. And from a fiscal perspective, we are actually down $7 million, but we're not overly concerned at this point about it given the number of months that we've had, and we don't start collecting premiums for the school system until September. So that's typical what you would see in this type of period for us on this report. Our average enrollees for medical ends with 5,974 individuals to date. I've also prepared some open enrollment statistics for you today. As you know, we had open enrollment from October the 15th through November the 5th at noon. This was our second year with the passive enrollment process that was voted on by this committee, and you can see that through the open enrollment of 2019 benefits, we had an active number of employees to participate of 6,356 who could have participated in open enrollment. During the open enrollment period, we had 3,259 that did access the system. Whether they made any changes, submitted anything or not, they logged in, and so we can track that. We had 3,097 that did not. That's 48.73%. And we had 2,780 individuals who basically allowed their benefits from last year to roll over to this year. And we know with the deductible plan, that was a significant concern for us this year. And we have just over 300 people that were on the deductible plan during 2018 that did not log in, who will be enrolled in that plan during 2019. And so last year in January, we did receive some phone calls of people who knew that their benefits would roll over and they didn't actively look at the open enrollment materials for that reason. And when those payroll deductions started, so did the ringing of our phones. So I expect we'll probably have a little bit more of that this year. The next page that we have provided you is every year after open enrollment, we will actually track option history. And this provides you with information going all the way back to 2010, and it breaks it out by certified employees, classified employees at the school system, county, which includes the highway department, and those that we currently have on COBRA administration. So if you'll look at the bottom of the page for 2019, you will see that we had a decrease in enrollment in the deductible plan to the sum of 59.70%. And then that results in 374 remaining on the plan. These are only the actives. Our HRA plan saw an increase in participation at 13.67%, and our copay saw an increase in participation at 19.12%. And I can tell you that we had a steady flow of traffic through our office. Many people took advantage of the opportunity to come sit down with either myself or someone within risk management to go over their benefits. I know there are other departments that assist in that process. Ms. Hickerson does at the highway department. She will meet with her employees individually as well. The sheriff's office does that, I know, to assist them with their annual enrollment process. And there's other departments I'm sure I haven't mentioned, and we appreciate that assistance to help spread the message, get people engaged, pay attention to those open enrollment materials, and make the most informed and educated decision. And more times than not, when someone sits down and has that type of discussion, and we look at what their utilization has been, their spending patterns, their out-of-pocket costs, what they've paid in premiums, there's usually a better plan option for them that will give them adequate coverage, reduce their out-of-pocket costs. And once we walk through that with them, more times they will change than not. Rarely ever does someone leave, I know in my personal experience, where they do not make a policy change, and that's based on actual hard numbers that we've looked at. Yes, Mayor, Ms. Hickerson.
Yes, ma'am.
I have a comment. While we're talking about the open enrollment, I realize we're right in the middle of financials, but I come in my office this morning and wrote down a little snippet about open enrollment that I would like for you and your department to know, but everybody on the television world watching this. I want to thank the Risk Management Insurance Department personally for Rutherford County by pulling off this successful open enrollment. You can tell by the numbers. Even in my office, I had 13 move from deductible to copay. So that's going a long way in saying thank you. People say it's your job to do this, but it's only part of what the Risk Management Insurance Department does. So I want to go and tell you thank you for taking the extra mile, because a couple of my guys did come to you and go through the whole, how's this going to help me if I change thing? And nobody asked me to say this. I'm saying it for myself as Mary Hickerson, as a county employee, and it only helps that I'm at the highway department. I do appreciate what you and the ladies and guys in your office do for the county employees. So a big thank you and a pat on the back for you and all the ladies and guys at the office, because I do appreciate it. Everybody, if you're not in it, like me, kind of sitting helping my 66 guys, y'all help the other 5,900. So if you're not in it, you don't understand what y'all do, and you think, well, I'm just calling them and they're putting me on hold. Well, y'all do a lot, and so I'm publicly telling you, thank you very much for doing that for me and all of the Rutherford County employees.
Thank you so much. I appreciate that. So, Ms. Sherrill, I hope you don't mind me sharing this, but that's how she got so excited to become part of this committee. Was she and I had met a couple years ago about her benefits. The next thing I knew, she made application. But the best compliment that we actually get is whenever an employee calls and says, you just talked to my coworker, can you help me? And so we really do appreciate those opportunities. So thank you for those kind words. If you'd like, we can go over Fund 266 at this time. There's not any more questions? Okay. So looking at Fund 266, which is our OJI and Work Injury Fund, year-to-date, we're at $315,911 compared to prior year-to-date of $400,106. Are there any reports about the financials that I can answer, questions? No? Okay, Mayor, I guess we're prepared for Mr. Good. Thank you.
All right, members, next on the agenda is the Workers' Comp OGI status. Mr. Good, Mr. Dan Good, Safety Coordinator, you're recognized.
Afternoon. I'd like to report in the month of October that we had 25 injuries requiring medical attention. You can see the nature of those injuries broken out there on your report. That brings us to a yearly total at this time of 224. Of that 224, 154 are considered OSHA recordable. 67 of them were restricted days, 35 lost time days, and 53 all others. On the next page, you'll see that the total incurred dollars for those injuries at this time is $54,768. And to project that on the graph for the next page, you'll notice comparing this year to the two previous years, this time in 2016 we had 163, in 2017 187, and at this time for this year 224 as of the date of this report. The incurred dollars at this time stand at $520,000, as you see on the next page, compared to the two previous years of $412 and $468. Just like to remind everybody on the incurred dollars, those are at the time of the accident. They can go up or down. It usually takes a year for those dollars to settle down, for the claims to get closed. So depending on what kind of results the individual has as far as the accident, whether those dollars go up or down. For the Board of Education, we had a total of 13 claims. Again, you can see the nature of those claims. And the incurred dollars there is $14,454. The county had the other 12. Total incurred dollars there were $40,314. Again, you can also see the nature of those claims. And the next page of your report, you'll see where those were within the county. The 12 break down between the Sheriff Department, ambulance, PAWS or Animal Services, and solid waste. On the last page of your report, I was asked by the Public Safety Committee to do a special report for them, and I've brought that to you here also. They wanted me to compare the employees to the claims and see what kind of trend we can find with that. And so I've gone back 9 years on that, and that's when the county started with the on-the-job injury program back in 2009. If you'll notice on your graph, the light bar graph there, in 2009, we had 243 claims, and that's going to be indexed on the left side. Also, the dollars at that time settled down to be $461,000. At that time, we had 5,778 employees, and that's indexed on the right side of your graph there. 9 years later, in 2017, we had 217 injuries, actually less than we had in 2009, and if you look across that, 2009 is the most injuries we had reported in the 9 years. Of course, the dollars continue to go up as the cost of health care goes up, and you can see that graph to see the trend on that. And we finished out in 2017 with 6,722 employees. And what you need to take away from this graph is that while the number of employees has continued to climb and increase, we've been able to hold steady and keep our injuries down. And just wanted to bring that out, and that's something that's significant that the Public Safety Committee wanted to bring up, wanted me to find out, and I wanted to bring to you today. That's all I have, sir.
Conclude your report.
Questions for Mr. Good?
Questions on the report for Mr. Good? Without objection, we'll accept the committee. We don't need a motion, do we? Okay.
Thank you very much, sir.
Thank you. Next, we will move into the wellness update. Mr. Chuck Chapa, Wellness Coordinator. He'll provide Smart Steps Wellness Program information. You're recognized.
Mr. Chapman, before you begin, I'd like to make the committee aware, many of you have seen Mr. Puckett up here with us. Yesterday was actually Mr. Puckett's last day. He does remain with Cigna. He is transferred to another state. He's going to work with the different school system and take everything that he's learned with Rutherford County with him and try to implement programs similar to ours throughout the state of Missouri, working alongside a broker in that area. So we appreciated the work that both he and Mr. Chappa have done, and I know we're still in good hands with Mr. Chappa here, and we will be backfilling that position through Cigna, so we'll have a second representative soon.
Much. To start, we have concluded the Know Your Numbers campaign for 2018. We have finished, the deadline was September 30th. Now we move into the report review process, and then we will continue into the appeal process after that. Preliminary numbers prior to the finalization of this report compared to last year, we're currently at an 89% completion for this year, as opposed to an 86% completion as of this time last year. So we've actually seen the numbers increase on participation and engagement as far as the Know Your Numbers campaign goes. And just to briefly review how that process will work, we will scrub every list that we have to make sure that every individual that we are capable of giving credit to will receive credit for that to completion with Cigna Systems along with MedPoint. Once that process is concluded, we will have the final list of names for those that did not complete the incentive, and then we will proceed to the appeals process where we will notify those members and they will have a time to appeal that process. So briefly, that's kind of how that process works. Moving on, we concluded the Rutherford County Wellness Fair. I'm proud to say that we have increased our numbers from last year. Last year, we were at 450 participants. We've increased that number to 507 for this year. So we've increased those numbers steadily over the last 2 years as far as participation goes. Just a brief review of some of the things that we've concluded there. We managed to complete 25 mammograms on site. We were able to administer 231 flu shots. 65 employees were able to complete a sleep screening. 66 were able to complete a vision screening. 46 completed a body mass index screening. 63 completed a functional fitness examination. 57 completed a financial assessment. 60 completed blood pressure screenings. We conducted 34 angio screens on site. 37 employees completed drug and alcohol screenings. And 60 employees were able to complete a bone density screening on site. So we saw incredible numbers for that. We want to continue to keep that momentum as we go into next year. We appreciate all your help with communicating that event. Just a little bit more info in regards to the angio screen results that came through. The average age of the employee who had one completed was 53. 6 participants did not have a primary care provider. 22 participants have either stage 1 or stage 2 hypertension, which was identified. 24 participants were identified as being in the category of overweight or obese. Participants with an abnormal ABI were 0, and 6 participants were identified that had carotid artery plaque. So we had early identification in that, and so that can continue on with follow-on care. So great numbers with that as well. That was a good outcome. Briefly, just some upcoming and current events that we have. We're currently in the middle of Holiday Hustle, our Q4 challenge. It's basically based around physical activity and nutritional assessment, basically eating a healthy diet. Maintaining that is a team challenge. We currently have over 110 participants in that challenge. We're trying to continually increase our numbers in those. We see some incredible outcomes as far as weight loss and diet change and lifestyle change through several of these programs. And I appreciate the communication that all of you send out and continue to help us get that information out into Rutherford County through that. The Life Services EAP program for this will be Caring for Aging Relatives. That'll be countywide. It's available online the 20th of November through November 30th. And then again, December 18th through the 31st will be Healthy Communication offered through the Life Services EAP. Lastly, I'd like to go over the program spotlight that we have for this month. It is going to be the Cigna Veteran Service Line. Now, as a veteran myself, the holiday season is a time period where extra watch and extra care needs to be taken. The National Support Line is very similar to the VA Crisis Line, the National Suicide Prevention Line. So the Cigna Veteran Service Line performs these services as well. So veterans can get behavioral counseling. Their family members and anyone that lives in their household is eligible to take part in this service. The greatest thing about this program is it's available, and you do not have to have Cigna insurance to utilize this. So any veteran, any family member that lives in that veteran's household is capable of using this service. In addition to behavioral and suicide prevention counseling, it also has things like clothing, food, security, housing, interview prep, if they need things for resumes, family members, if that veteran is having trouble securing school supplies or food for their family, it provides that service as well. And again, it's available 24 hours a day. You do not have to have Cigna insurance, so it is available to any veteran, anywhere. I would ask you to take this as far as you can, because like I said, during the holiday season, this is a time for extra watch and extra care on our parts to make sure that everyone is taken care of, receives the services they need. And that'll conclude everything that I have. Any questions?
Any questions? Commissioner Allen.
On the drug and alcohol screening, are those
Yes, ma'am.
pre-employment screens?
No, these are just simple, it's a simple questionnaire where they asked and it identified whether they may or may not have certain conditions. So it was just an on-site screening. It's not a pre-employment screen.
Other questions on the report? Seeing none, thank you very much. Very good report.
I would like to provide one clarification to the committee based on a comment I made earlier about Cigna providing for the 2 wellness coordinators in our office. Within risk management, we have under contract, through our contract with Cigna, they provide us with 2 on-site wellness coordinators. We also have our I'm going to mess up her title, but she is our client contact at Cigna with any issues that we need assistance with. They also sit in our office a couple of days a week. And because it's been mentioned to me in the past, I do want to clarify for the committee that at last renewal, Cigna actually, over the course of their new contract, reduced costs by $500,000. And so that's important to me that you understand that yes, those costs are built into our contract with Cigna. They would be built in whether they were providing that support remotely or on site. Given the size and nature of our organization, that's why they put them on site. But whether with Blue Cross Blue Shield, Humana, any of the big players, we're going to have some wellness resource there. And so I just want to get out in front of any thought process along those lines and just clarify that particular piece for you all.
Good. Okay, next on the agenda is the midpoint report. Shannon McNair, Director of Client Operations. She will give us a monthly clinic utilization report. Ms. McNair, you're recognized.
Good afternoon. If everyone will open their midpoint report that we have for you guys this afternoon, and we're going to start on page 2, which is just a snapshot of our clinic visits. If you will see, for the month of October, we saw 3,124. And I'm just going to back up to September as well and just point out that we saw 4,568 in September, which includes those biometrics that we wrapped up by September 30th. So just wanted to point out that increase there in September as well. We successfully had flu shots given at the health fair with the wellness team. We gave a little over 300 flu shots at the health fair. So we were very happy with that turnout. And then after that, the next 2 weeks in the clinics, we had walk-in flu clinics. So we saw a lot of patients come in through there as well. So those are those additional numbers that you're seeing reflected there in October as well. We'll turn to the next page. We have our wellness visits listed. So our wellness coordinator in October saw 36 visits. 34 of those were follow-up visits, and 2 of them were initial visits. Our registered dietitian in October saw 9 visits, and that was 5 follow-ups with 4 initial visits. I would like to point out in October, as most of you know, there was fall break during that time, and what we tend to see is during fall break, we have less visits for our wellness people because people are out of school, they're on vacation, so they tend to not want to schedule that week. And then another note to point out, my registered dietitian was out for half of the month, so that's why you see that decrease compared to previous months for her. On the next page there, the per employee summary. So you've got your office visits again in October, 3,124. Total operating costs at $254,014. Cost per visit is $81 and PEPM at $42. The increase from September and October, even though we had more clinic visits with Quest, which is where we send the blood work for the biometric screenings, they bill us for September and October. So that's why you see that increase not matching up with the visits from September, because we get the bill for that in October. The last slide in the report is a new slide for you guys. We have recently, in August, we changed over to a new phone system. We're really excited about this phone system. We know that this has been a pain point in the past, and so we are really trying to make some adjustments so that we're making it easier for our patients and your employees to reach out to us. So that's why it's grayed out from January through July, because we didn't get the new tracking system and the new system in until October. So, I'm sorry, August. So in August, we received 2,631 phone calls, which it comes out to be an average per day of 114. And then obviously in September, the biometric deadline was coming up, so we had that increase in phone calls at 3,951 for the month of September, which is an average incoming call of 198. And in October, we saw 2,320 incoming calls, and that's a incoming call average per day at 101. And just wanted to point out, this is incoming calls. This does not include us calling patients to speak to them about their lab results or med refills or returning phone calls. So this is only incoming calls listed here.
Any questions? Seeing none. Thank you, Ms. McNair. Members, next we have the Cigna Award presentation. Mr. Paul Huffman is here in attendance. He wants to present a Wellness Award to Rutherford County Government and the Board of Education. So we must have been good this past year, right? And didn't get sick during vacation.
I'll come up here too.
Kind of funny how that works, right?
All right, well, thank you, Mr.
You're
Dutcher
recognized.
and
Yes, sir.
Ms. Street. One of Cigna's many goals is to help our clients achieve a culture of well-being and provide the resources and tools for them to do that. We created several years ago a well-being award. It's a distinct award that we award once a year to a client that demonstrates a high-level culture of well-being and success in building a culture of well-being among their employees. Clients are asked to fill out an application and submit it to us, and our Well-Being Award Committee reviews those applications each year and finds different clients that highlight or stand out. Our Well-Being Award Committee looked at Rutherford County's application process and identified 3 key areas where you stood out. One is the success that you've had and the commitment that you've given to your Smart Steps program that you heard a little bit about earlier today. Secondly, the collaboration that you have with Cigna and the on-site team in developing those resources and the consistent leadership support that is given. Okay, so we really recognize when a client has leadership from top down that supports any well-being programs, we usually have a higher success, and you've demonstrated that. And then number 3, a significant or robust promotion of the events. So you're not just throwing them out there and letting people find them, you're promoting them and encouraging them, providing incentives. And in doing so, that generated a pretty high participation rate among the programs, so that stood out. So As a Cigna Senior Account Manager, I'm proud to announce Rutherford County Employee Benefit Trust as the Tennessee recipient of the 2018 Cigna Outstanding Culture of Wellbeing Award. Congratulations. I'll present this to Mayor Ketchum and Ms. Street, and if, Shannon, if you take a picture, you can stay back there or come up front, either way. Y'all come up here. That's great. Sorry? Yeah. All right. Mm-hmm. Thank you. Thank you. Thank you. Congratulations. Thank you.
Well, thank you. It's indeed a pleasure to be recognized on a statewide basis for any accomplishment, but it just shows what a good community that Rutherford County is, and we strive to be the best county. We want to set the gold standard for the other counties to follow. So thank you very much for all the departments involved in this, and we all accept it on their behalf. Next, we have the 2019 Wellness Campaign. Ms. Street.
You'll have before you a proposal and some information from Cigna that if the proposal was adopted, that we would utilize to provide information to employees. And so, as you know, over the last several years, we've had our wellness campaign focused basically on two things: an annual biometric screening for the employee enrolled in our medical plan and their spouse if they participate, and then also completion of an online health risk assessment. And knowing that in order to can expand on this program, keep the engagement level as high as it is, and to really drive those costs down within the health plan, we need to expand what our wellness initiative is going forward. We recently met with Cigna actually this week, and you will get an abbreviated report next meeting of what our last year has looked like in terms of our spend and other analytics that were provided. And during that meeting, as an example, 5% of our spend is directly related to cancer diagnoses within our population. Cancer, it can be found through early detection, through preventative screenings and other things. And so that's one diagnosis that we pay close attention to whenever we go through these reports year over year, and other things that preventative services would reveal. And so what we are proposing beginning for 2019 is that we would provide employees with a list of preventative screenings that they could choose from. And they would need to accumulate up to 3 points for themselves, and their spouse would have to accumulate 3 points if they participate on the medical plan between the dates of January the 1st, 2019, starting next year and every year thereafter, through the September 30th deadline. Now, you'll look at that and you'll see that the annual physical shows for 2 points, and completing the online health risk assessment is for 1 point. The annual OBGYN exam has a value of 1 point, a flu shot 1 point, a mammogram 1 point, a colon cancer screening 1 point, cervical cancer screening 1 point, and prostate screening 1 point. Now, if it's a diagnosis or a diagnostic treatment, it won't show up as a preventative. These would only be for preventative-based screenings. And the reason that we've done the annual physical for 2 points is because of the early detection process. There's a couple of things that happens, and you can see in the materials that Cigna has provided to support what I'm saying. When someone has an annual physical, it allows for both early detection and establishment of a relationship with that provider, which will make the employee more inclined to go if they ever feel ill. And so we want to make sure that they have access to health care. We do that through both our clinics, and this process would continue through the wellness campaign to incentivize and encourage employees to go have a primary care physician in place, whether it be in the community or through our MedPoint clinics. During the reporting process with Cigna, We did see that preventative care as a percentage of total spend is 1.9%, and that was above the norm for their book of business, which is 1.5%. The well visit completion rate for adults increased this last year of review from 41.5% to 42.3%, and there's a normative value of 33%. Breast cancer screening rate was 73%, which was 12% greater than the norm. Cervical cancer screening rate was 70%, which is 13% greater than the norm. And colon cancer screening rate was 39%, which is 7% less than the norm. Well, that doesn't necessarily surprise us. There are a lot of people that dread turning the age for the colonoscopies, but we do still see that a significant portion of our population is already doing that. And I share those numbers with you to say this. I know when we put more requirements on employees that there's that initial hesitation. We have already demonstrated our ability to effectively communicate the wellness program through the statistics that Mr. Chapa has provided with you all, and shows what the high numbers are that we get of people completing that process. We already have people above normative values who are completing preventative care services. You know, for me personally, just in my regular getting a flu shot and going to one of my doctor visits a year, I've already satisfied this particular, and there will be a lot of people that's like that. The other thing that this does is it reduces the amount of paperwork for the employee to be concerned with, because it's going to be all claims data that we will be pulling from in order to verify the points have been accumulated. So no more making sure that their doctor completes the biometric form and signs it in, or, you know, after the deadline they realize the doctor didn't do it and now there's issues to deal with like that. This is a natural expansion of a program like what we have in place. Another option of expansion would be like a tobacco cessation, where, you know, we would want to go into BMI and other metrics, and I don't think that that would go over very well. But we do want to make sure that early detection is in place. So it's the recommendation to the committee that we modify our wellness campaign effective 1/1/2019 and thereafter until a different plan is adopted, to allow for the 3-point system that's been proposed for the committee today. Ms. Stevenson.
Questions? Sonia?
Am I on? Yep. You've done the department and the county has done a good job with the 3-point system, and what if we moved it to a 4-point system? Because then most of the people are already doing their online assessment and their physical. Do we not? We have really good participation in that now, right?
Well, our well visit completion rate, we're at 41.5%. So we still have
Some room to go. Okay.
a lot of, yeah.
I was just saying that one more assessment might improve our numbers a little bit if we
Yeah,
had that.
you know, it may be that we start at 3, and then in a couple years we decide to up the point system. You know, that would give us room for growth. I'm not necessarily opposed to it. We just need to define what the parameters are.
Other questions?
I have another question.
Yes.
Oh, okay. I'm thinking here, and the first question on a quick look for simple mind of me, there would be no more blood draw?
Depends on the doctor. So some doctors will include labs as part of their annual physical, and some don't.
Okay. And the only, I mean, knock on wood, I do mine because I appreciate keeping my $300. But what's gonna throw me off, I can do the blood work because I have to do it twice a year. But on like the physical and a mammogram and just the girl things or whatever, all of that, a lot of folks, and I being one of them, some of this falls after 9/30, but before January 1st. And it's a red flag to do it again too early.
Right.
And so, I mean, these are very smart, and you can get a flu shot anywhere and it'll go through. But I'm thinking on the annual physical or like a mammogram or a flu shot or something like that, looking at this, mine are from 9/30 to January 1st. So is there anything we could potentially do I don't know, I'm throwing it out there just because of whatever. Could we start have a deadline of 9:30 because we got to have the numbers for January 1st, but could we go back for the next year and start picking up October 1st to 9:30?
So I want to remind the committee that when we first rolled out the program, we tried to address this issue, and we ran a 15-month program the first year, which is unorthodox. And it's difficult and complicated because premium deduction changes start on January the 1st. So I appreciate what you're saying, and I do see that issue. What we could do is run it through October, and the reason that if you remember, initially we did run it through October. The reason we changed it is because open enrollment, all these deadlines was hitting, and so we wanted to have that part done so that all of our communication would start on the other, right? The last quarter of the year is extremely busy in terms of data collection and getting everything modified in the system so that come January, proper deductions take place. So having said that, even though so here's an example. Even though your annual screening, you may routinely get it in November, it's going to be no cost to you because it's preventative screening, right? So you could go in January. After this one goes in place. Right. Rather than go in November, you would wait and go in January. So now you're within that window.
Okay, I totally get that, but what if I have what if I have medicine tied to that annual?
Yeah, I mean, that would be-
I'm trying to think
I
of-
agree.
of
Yes.
outside the box, because I myself happen to fall later on in the year, but other
Yep.
things I do, I was able to do the questions and blood work, which I think these are wonderful ideas, and some of them are most definitely with an aging population. We should be seeing some of these screenings, and my thought was we could cut it off September the 30th. Then y'all collect your data for 2019, but let us start October 1st of 18 for 2020, because if I understood right, now really it's not a piece of paper, it's a diagnostic code that goes through Cigna.
Correct.
Okay, that was my only thought. If it's just going to be a number thing, and Mr. Paul could probably speak to it, how easy would it be to capture, October to September 30, to capture those, but still give yourself October, November, December for the next year coming?
But the 12-month program starting October 1. Sir, can we bring Mr. Chapa back up? He's the one that has to handle all the reporting. He'd be best to speak to that. I mean, I think it's doable. I think it's going to be confusing for folks because they're going to think calendar year at that point. That's my concern. They're going to say calendar year, and this gets me into and it's going to be hard. I can tell you even now, because time goes so quickly, as we all know, people will think they've already done like the online HRA, and then, thankfully they'll go in and check their points and realize, oh my gosh, that was actually not this year, but last year that I did that, and so can we just walk through your initial thoughts on pros and cons?
I'll start first. So what you've recommended or what you've mentioned is doable. Okay, so you can set it up one of two ways. One is you're still setting a campaign for a calendar year basis, and we kind of in the back scenes, we know we're going to go back and do a look back period and capture anyone who's done anything since October 1st, and you may not promote it, okay?
It's like a soft opening.
You could
What
do it
about,
that
Paul, though, if they go trying to, so let me give you this example. Let's say that routinely they get it in October, and now they have scheduled it for September of the following year. So October of 18 they went, and now they're going to go September of the following year.
Fine.
One, is the plan going to pay for both at 100% if it's preventative? And two, are we putting the employee, I guess the next year it would be on cycle then for that
So
that period.
let me give you a big secret that you may not have known. You can do as much preventive care as you want every year And you can do it twice, you can do it 3 times, you can have, we do not police that. We don't check to see if your last visit was 12 months or more, okay? So that's more like dental. But for medical, you can get a preventive visit as often as you want. Most people don't, because it's not fun. So if you go in September or in October and you want to go in September the next year, that's fine. There's not going to be any issues with doing it 10 or 11 months since the last one. But if you want to set up your program to still be from an October 1st to an October 1st date, that's definitely doable. And then have that reporting apply to the next calendar year, if that.
I think I know the answer to this, but the preventative is covered under the insurance already. So if they call in and make an appointment with their doctor and say, I need to have a preventative physical or preventative testing, then that's going to be covered under the insurance based on the plan that they have. I guess what my thought was is I don't want an employee to go and get their physical or whatever during their normal time, say October for Mary, and then her go back in January and get another physical and her have to pay the full amount, the doctor's visit, for the cost of it, which it would have been covered the first time, but she's not out of that 12-month cycle yet to get it
Like I
covered.
said, there's no 12-month cycle, so you don't have to worry about that. It's still, as long as the doctor codes it as a preventive visit and they don't find something that they're diagnosing or treating, as long as it's a preventive visit, it can be done before 12 months, twice, okay? And it'll be paid at 100% covered. Do you have any comments regarding the reporting of it, how that would?
I mean, it would function the same. The biggest thing with this is we would communicate effectively with the campaign what to ask for, how to go in. I mean, that would be a major component to that campaign, is what to ask, how to ask, what you need to do, things like that in communication with that campaign. So that would be rolled into how we would run that.
What do you normally see, Paul, in other governments, be it county or city? Because I know seeing is in a lot of places like that. Do you see the January, not necessarily January to September, but the month period? Do they normally cut it off, or do they do a calendar year?
Mr. Huffman, before you begin, could you expand that question and talk about what you see when you walk into Metro Nashville Public Schools and their wellness focus?
What do you mean? What?
Their beautiful facility with their full gym and Kroger and everything on site.
Oh, that's true. So, yes, Nashville Public Schools does have on-site clinic. They've built a, $4 or $5 million building that they have as their headquarters for their employee wellness. So, yeah, and they have an on-site pharmacy with Kroger, full staff of nurses and everything. So, yeah, you are dealing with that. But with regards to Motivate Me and the incentive program, it's across the board. And Amy, would you agree? I mean, we do have clients that set a start date of January. They might set an end date of September 30th like you've done, or maybe November 1st. So there might be 1 or 2 months left out where people aren't getting captured. But most clients do request that we have that look-back period. In other words, go back to October 1st, and if someone has done something during that time, count it. So essentially making it a 12-month reporting period, but an annual campaign period, so that no one is missing out and you don't have to time when you get your visits, unless you want it for a certain calendar year. So if you want something done for 2020, you have to do it before September 30th. Yeah.
Other questions? Joe?
Okay. The flu shot was the one that came to my mind because we have our health fair.
Your mic's not on.
Can you use yours, Dr. Anthony?
Hey, is this better?
Yes,
Yes,
sir.
sir.
The flu shot is the one that came to mind for me, not for me, but because we had our health fair in October, and we had 300 and some people get their flu shot then. I like the idea of that look-back period if it is feasible. I also, based on our meeting Tuesday, had another thought in looking at this list. Any chance of adding a dental exam?
So that's actually something that I would love to do, and I know that I've talked about it in this meeting several times about how, the mouth is kind of the window to the body, and it gives you a lot of early indications of disease process. And we've actually have done a study, about 2 years ago, Paul, is that right? At, what if the county provided employee-only dental so that we could then make it one of our wellness initiatives? Because our dental enrollment runs about 4,500. And if you'll look at what our current enrollment is in our medical plan, you'll see that we're at 5,974. So we've got about 1,500 people floating out there, which is the whole reason why we put that HMO out this time, was to give a lower cost option, to get people to start going to the dentist. It was going to be about $1 million for us to provide employee-only dental coverage, which I think we should revisit at some point. When I asked about it, and I'll let you all explain kind of the Cigna process, if we were to ever do that, as I understood the platform, the Motivate Me platform currently does not track the dental. It's not included on the medical, so there would be some manual manipulation that would have to occur. I don't think that makes it impossible, but the problem would be that when people log in to see their points, they would not see that preventative, that routine dental service being there. So we would have to work through those type of challenges, but I completely agree with you, Mr. Sandvik. I think it's something worthwhile for us to look at.
Commissioner.
I had a question based off something that Mary said. In her case, if she's got to go twice a year and she has medications tied to those visits, are those going to be diagnostic visits or are those going to be preventive visits? Because it's part of that education campaign you were talking about.
Again, it's going to be how the doctor bills us. So her annual physical will be coded as a preventive exam, so that will not come through. But any of the diagnosis codes that come through in addition to that could go towards a deductible or coinsurance. But the conversation that Mary would have with her doctor is, this is my annual physical. Medications associated with that tend to be outside of that program, so we would not charge for that visit. But again, it's going to depend. We have doctors that submit it incorrectly, and Mary would have to call in and say, that's not why I was there, and we can get it reprocessed. So I can't say 100%, but the intent is everyone is able to get an annual physical, even if they have ailments that are constantly being checked. And
Another thing, too, is I want to remind you that all the services that we were talking about in terms of the annual physical, the flu shot, those can be done at the MedPoint clinics as well. And they will actually submit data over to Cigna so that it will give credit at Cigna whenever they look at the point system, and it generates an EOB for that visit that you all who are on our health plan have received in the mail before, I'm sure.
Other questions? I'd like to ask the committee if they'd be willing to accept a challenge. We have money set aside, I think, from Cigna that goes into the wellness campaign. I'd like to see us buy pedometers and to give to each employee and every department, challenge each other for a 30 or 40-day period, 45-day period, the number of steps. That's how you change the culture of being well. We did this in the General Assembly a couple of years ago. The governor got involved and everybody got excited about it. I think we've done this previously, but it won't hurt to do it again. You can buy pedometers for $0.01 a piece and get every employee to wear it and record the number of steps that they take. You'd be surprised how many steps you take, but what it does, it creates that focus of, oh, I'm going to beat them. I know Sonia, she likes for her chili. When we had the United Way program a couple of weeks ago, she wanted her chili to be the best, and the departments take a lot of pride in competing against each other and challenging each other. And I know Lisa, she'll run, half a mile just to beat somebody, or 5 miles a day or whatever it may take. So her department's already, coming out. Is that something that the committee would be interested in purchasing pedometers and challenging our employees to get well and be healthy? And it all starts with one step. It's only going to be
Kathy, you wanna talk
$600 for
about-
6,000 people.
Yeah, and once we have this discussion, Mr. Chapman can also talk about the different things that we have done for some of the newer members, that have been around this as well. So there would be an opportunity to repeat use possibly of those pedometers.
We could accommodate that with the wellness funds that we have. In addition to, as an award with the Rutherford County Employee Award, we've been awarded an additional funding, so we could accommodate that with the new Wellbeing Award as well.
Yeah, that wasn't inscribed on
with
there, but
that.
that's good to know.
Yeah.
Thank you.
That's all right.
Yeah, well, thank you for the additional funds also. So is everybody okay with doing that?
I'd like for them to maybe come back next month and give us an exact number of what it is you're providing and what it is going to cost, maybe what's in that reserve, because instead of just saying, yeah, let's do it, I'd rather know what that cost is.
So let's talk about the budgetary process for the wellness program and how do we pay for the things that we do. Every year, Cigna, as part of our contract with them, provides $40,000 in funds that we utilize to everything that you see, from the wellness program to the giveaways that are purchased, everything that encompasses wellness expenses comes out of that $40,000. So break that down to the number of employees we have, and you can see that's not a lot of money per employee for us to run our wellness program off of. We've been given an additional $5,000 as
There's
a
an additional
result.
$5,000, and I would like to order these and get them ordered before this kicks off in January 1.
Yeah.
For a penny a piece, that's only $600. I think it's, you wait another month, you're going to get in a Christmas rush, and then you're actually starting it after the fact of the campaign. My thinking is we get it started at the very beginning of the year. That's when most health clubs are full for at least the first 30 days, because everybody wants to keep their promise after they eat their black-eyed peas and their turnip greens for New Year's, but at least they keep it for a month. At least we can start some competition and get people focused on it.
But what they do have, just to expand on the budget, so at the beginning of every year, we'll have a meeting, and they will talk about how they will break down that allocation of that money and present it to me for review. And there are already costs set aside for these type of giveaways and things like that. I know that doesn't speak specific numbers, but I do think it's important that you all understand that there is a process behind how we utilize this money, and we don't just randomly, pick and choose throughout the year where to spend money and end up short at the end of the year. It's a tightly managed process.
And what are normally the giveaways?
Range, depending on the quarterly challenges, we may do an iPad giveaway. We've done gift cards in the past. We've done Apple Watches. We've done Fitbits, different forms of trackers, things like that. Usually they're based, each challenge will vary. It's either a team or an individual-based challenge, and those will be the prizes. But we run at least one a quarter, so one every 3 months is typically what we run a wellness challenge. And those are
110 individuals right now, is that
We got
right?
110 currently in this one. We average about 100, 110. We try to increase participation and communication each time. And again, that will go into the communication strategy for that, as well as getting that countywide, getting that leadership buy-in and participation as well.
Sure. Ms. Allen?
When did you say you do that budget process with them?
So the money renews in January of every year, so like right now, we have a meeting that starts at 7 in the morning. That's when we get the wellness team together, and that will be part of our budget process coming up probably next week. We'll start going over that in our morning meeting to look at, what are we going to allocate to. So we don't get down to the specific line item like we're going to buy, this, but we know we have this much money set aside, and like, did we come in or under budget on the wellness fair? We were under budget, so we'll have excess there that we can roll over to another campaign. So I'm not overly concerned about the funds being available. I mean, that's going to be there even without the $5,000 most likely.
Well, and I think exactly what you're talking about, reinvesting back into the wellness and buying this. I think it's a great way to honor that award and those funds that were given. I just didn't know, we're talking hundreds of dollars or thousands of dollars. I just wasn't sure what that number would be. If we can get them a penny each, terrific. But if we can't, I just wanted to know what was that number.
We can put together a proposal and identify exactly what the cost would be based on what it would be realistically. And
I just Googled it, penny piece.
Well, and I was going to say, too, we could always just pass it contingent upon there being some ceiling
Yeah,
of
exactly.
what the cost could be. That way, if it comes in under, you've got time to go ahead
I'm
and
just
go.
trying to create excitement and get people to kick off the new year and compete against each other and make this the healthiest county in Tennessee.
So could we, and that's what I was going to recommend after you finish, could we do $1,500 as a recommendation? Would you all be agreeable to that? I mean, you're talking about 6,000 pedometers that we will be purchasing. I mean, it's a lot of pedometers.
That's 600.
Yeah,
Any piece.
right, I understand, but I'm just saying that, just to give us some leverage by the time that we purchase, if it goes to 2 pennies, then we're not back here again, and we can go ahead and proceed forward, because you're only talking 2 cents per individual or whatever.
Not so hard for the county as far as getting those distributed, but might want to be thinking about how all those schools will get them distributed in their schools too. I mean, for the counties, most of the departments are pretty small, so.
Yeah, so we've dealt with this challenge in the past. We've gone out to schools and stuck them in teachers' mailboxes before. I mean, that distribution will make happen, yeah. So we have 2 things right now up for discussion. Let's go ahead and finalize, if we could, the discussion about the pedometers and, see if we can make a decision on that, and then we'll go back to the decision about the wellness campaign going forward.
I'm happy to make a motion that we spend up to $1,500 for pedometers for the employees.
Second.
Got a second? Motion and a second. All in favor, signify by saying aye. All opposed? Motion carries.
Is there any more points to be raised or discussed about the wellness, Mr. Stanby?
I'm ready to make a motion. I'd like to make a motion to approve the proposed 2019 with that look-back period, so October 1st of 2018 through September 30, 2019.
So just for clarification of the record, you're proposing a soft opening from October 1st through December 31st and a published period of January 1st through 9/30 annually. Yes, sir.
Okay, did everybody hear the motion? I'm kind of deaf in one ear, so I guess everybody heard it. And got a second? Questions? Yes, ma'am. Okay. All in favor, signify by saying.
Ms.
I'm
Crowell.
sorry. Yes, ma'am.
Afternoon. I was wondering if there was any way we could expand some of these screenings, include other screenings,
That would,
maybe at a lower point value. But most of these screenings are really hitting the 40 and over population. And I know at Rutherford County Schools, we have a large number of people in their 20s and 30s, about half.
so our average population throughout Rutherford County is 40 years old. And I do see your point, and I understand. There still would be, regardless of age, everybody needs an annual physical. The flu shots, we'll probably have to have Ms. Summerlin come back up and talk about any opportunity for expansion. There's only a certain preventative set that they can actually track and monitor in the Motivate Me. Ms. Summerlin, are you available to give other options to what that could look like?
I'm specifically wondering if we could continue at least the biometric screening for one more year at a 1-point value for our 20-somethings who maybe do not have a primary care physician yet, and add in maybe a depression screening for women in their 20s and 30s, particularly postpartum.
Okay, so let's handle the first one. Can we track the biometric screening through the Motivate Me platform if we were to add that at a 1-point value?
If we put the biometric screening back in, we could add it, but it's not claim validated. It'll bring that form back in. So, but we could add that back in. What was the
Okay,
second?
so just for clarification, we can add the biometric screening. One of the advantages of this program is there's no paperwork for the employee, but if we include the biometric screening, then we will utilize the same form that we've used this year. Probably not that big of a deal if we continue it next year. If we wait a year and try to reintroduce it, then that would probably be more complicated. And then the second is the depression screening process.
That is not a goal that's available on the platform at this point, so unfortunately that wouldn't be able to be to be
Are-
added.
Are there any additional screenings that are included in the platform but are not included on the list that I see in
That
front of
list
me?
is, at this point, the only list of screenings that we can track and report back. There are other goals available that may not be screenings, but we have other ones like absent activities, and some other things that might tap into the younger population where they could engage that way. So there's other goals, but not screenings.
And so these other goals, I will caution you on because they're self-reported goals. And if we've learned anything from going from an active to a passive process is that people are going to take the easiest route, right? Now you've got self-reported goals. It's September the 29th. I'm picking up the phone and I'm calling Cigna and I'm saying, I've done XYZ because I need one more point. And I just don't want to turn the program into a self-report process because then I think we're going to lose some of the momentum that we're currently in.
What about something like a postpartum screening, or, I'm sorry, like the postpartum follow-up visit?
So
The one that
there is a program called Healthy Babies that we have. And
Right.
And part of that program is after delivery, and Amy, you know the period of time it is, but the clinician will reach out to them. And part of what they're doing in that is that they are doing that type of query and working
Screening.
with them to see are there additional services that they could recommend to them based on some of the responses. And just feel free to jump in and correct me if
that's
I
Why couldn't
should.
we include that as a point
So
value
it's,
here?
well, it's actually part of the Motivate Me, but it's a separate bucket. The only incentive available is the debit card, the gift card, so that there's an option for $150 if people enroll in the first trimester. So they have a call first, second, third, and postpartum call, and they go through all the depression screenings and questions. And then the second trimester is a $75 gift card. They go through second, third, and then postpartum call to get the reward. So it is on Motivate Me, but it's not a points-based. You can't really change that incentive, unfortunately.
And I would
It
want to
would
change that
be the
incentive for them.
manual, it would be the manual combining of the information. It's kind of the same issue that we have at the dental. So it wouldn't reflect in their points value because it doesn't pass through the Motivate Me system the same as these other recommendations have.
I personally like this. I like this idea of offering people options in order to get a point value, in order to get their $300 deduction per year. But I don't like it as is. I think it needs some additional things for our county, specifically for the Rutherford County Schools population. And I wish we could add in some manual options for our younger crowd. Is there any way that we could table?
That's up to the wishes of the committee. You are welcome to make a motion as to what you'd like to see added, and we can speak to whether or not it's possible. I think maybe one thing that may be helpful is you have other school systems that do this within Cigna, and have you seen anything along the challenges to speak to the points that Ms. Crow has brought up?
So we do have a lot of school systems that have the Motivate Me platform in place along with the other corporations. We do steer away from the self-reported a lot because it's the honor system and you can't really get a good read and feel for people who are actually doing what they're saying they're doing. Other options, we have goals that are in place. We have online coaching, we have telephonic coaching for the chronic population. So there's other things that people put in place for the healthier population, the younger population, if they don't think that those goals will satisfy that group. I think our intent when we have been, we've been talking about this since at least June, trying to put this together, and we thought at least they could do the health assessment and a physical or a flu shot, so they would be able to get their points. The physical we set up for 2 points, so if they go in and do that, anybody at any age can go in and get a physical, and then anybody at any age can do their health assessment online or on their phone. So that was the intent of the program, to make sure that they had an option, they had a couple, the under 40 group, to be able to get their 3 points.
And that's really the reason why we put the annual physical at 2 points, because it is such a basic testing that everyone, regardless of age, needs to do. And the thing to remember, Ms. Crowe, we can always start with this, and if we run into issues, reevaluate it for next, the following year. But based on the experience and feedback that we got from Cigna, I don't think that we will. Even someone who's pregnant, as an example, is going to go for that initial OBGYN exam, and we have lots of babies, as you know. So, yeah.
Okay, then the only thing I would ask is that we include the biometric screening for one additional year at a 1-point value.
And that would be, include the form, but it would be tracked through the same Motivate Me platform.
Right. If
So
we
no
add the-
manual manipulation of the data.
Yep, so if we add back the biometric screening, then that will not be claim validated like the others, so they would have to have the form, but it still would be tracked through the Motivate Me system.
Jeff?
I would like to
She wants to make a...
add the biometric screening in, and did you suggest 1 point? Ms.
Well, we have a motion before us. Do you want to make an amendment? You're making an amendment to the motion?
Motion, yes, sir.
Yes, sir. All right, so before us, we have an amendment to add the bio screening for 1 year. Is that correct? Yeah, okay. And a second. We're back on the original motion as amended.
1-point value. And that was with 1-point value.
1
based on
point value.
recommendation.
Read that into the minutes. Okay. Got a motion on the amendment. Let's vote on the amendment.
Can we read it back, sir, to make sure that we've documented it
Yes.
correctly?
Okay. Madam Clerk, if you would read that back.
We have the motion, the initial motion was to modify the wellness campaign as of January 1st, 2019 to the 3-point system with a soft proposed look-back period, October through December, and then it be posted for everybody January through September.
That's correct.
Okay. And then the amendment is to include the biometric screening for 1 year at a 1-point value.
Okay. Everybody understand, we're going to be voting on the amendment to the original motion. All in favor of the amendment signify by saying aye. All opposed. Motion carries. Back on the motion as amended.
Good job, Miss Allen.
Sorry for the red face.
You got through it, that's all that matters.
Okay. All in favor of the motion as amended signify by saying aye. All opposed. Motion carries. Thank you. Okay, next, members, we have the broker record for employee benefits. Ms. Street will provide a review for bids for the broker of record on the RFP that was sent out. The finalist presentations will be given by Willis Towers, who is the incumbent, Willis Towers Watson, and then by the other, Mercer. I'll turn it over to Ms. Street.
Thank you. Mr. Chapik, would you please present to the podium for a second with no objection from the committee? We may as well demonstrate a few things that got us this award because we've all been sitting here for a few minutes, and I want to make sure that they're alert. This is complicated information, so walk us through a quick little stretching exercise to wake our brains back up.
All right, I'll get everyone to stand up, please. Go ahead and take your arms directly out in front. We're going to do small circles to the front. Nice small circles. We're going to make them slightly bigger.
Sorry.
Don't hit your neighbor.
Too late.
Stop. We're going to change position, change rotation.
As the risk manager, I'd like to say this is voluntary, so if you have shoulder issues or whatever, you're welcome to sit.
We can provide. And relax, arms down. You'll take your left arm, put it across your chest, and squeeze it. Pull it into your chest. And if you'll change arms. And relax.
Everybody feel good? Thank you, Mr. Chaffer. We appreciate that. Okay.
Well, as my dad always told me, he said the brain can only absorb what the posterior can endure. And I use that comment quite frequently when I passed this past spring putting physical education back into our curriculum, school board members, because it makes a difference in the way little kids can, that's K through 6, we're putting it back into the curriculum. I don't know when it disappeared, but at least we're getting kids active and with teachers and kids, they just, they need to stimulate that body so the brain can refocus. Okay.
So we'd like to invite Mr. Diaz from Willis Towers Watson and his team up here. The format for today will follow, which is what we have typically done in the past. We'll allow the incumbent to speak. I've given them 20 minutes of presentation time. It's intended to be interactive and somewhat informal, so feel free to interject and clarify any of the information being presented. And then there will be a period for question and answers, at which time we would allow them to leave, and then we will bring in Mercer and allow them to do their presentation under the same format. There was a group of individuals who did initial evaluation of all 4 companies that submitted bids. Those included Willis Towers Watson, Lockton, CBiz, and Mercer. Those individuals that participated in those interviews were myself, Mr. Sandvig, Ms. Stevenson, Ms. Allen was there, our senior benefits analyst, Melissa Griffey, was there, and our other benefits analyst, Stacy DePriest, was there. And we met and interviewed with all of these 4 individuals that submitted the bids. Based on those discussions, it was decided to present Willis Towers Watson and Mercer today for your consideration based on the information that was obtained during that and clarification of their bid processes. And I've provided you a spreadsheet in front of you, and what we do is we actually go through the bids and spreadsheet this and show you, how thorough in the RFP they completed the process, providing all of the important details about their bid, and it will talk about client references and technical abilities and things of that nature, which they will talk about today as well. Once both interviews conclude, we will discuss the financials, both currently that we have and as well as the proposed, and then I will share any feedback from the interview committee that is requested with you all. I'm happy to share their comments and anything that is of interest. So if you'd like to go ahead, Mr. Diaz, we can.
Mr. Diaz, I've got to step downstairs and talk to our sheriff real quick, so I'm not leaving you.
No, sir.
I don't want you to think I'm walking out on you.
Sir,
Okay.
we've typically
Thank
had
you,
Ms.
Mr. Mayor.
Hickerson take over whenever the chair has
please.
stepped out.
Yes,
Would you like
please.
to do that?
While they're swapping places, can you give us just a quick job description of what we're hiring them to do with the broker?
Thank you so much, yes. So for clarification purposes, I would like to say that when we get into the financial piece, and I just had this conversation with some of our school board members, which I appreciate their participation here today, the broker will assist us with the RFP process for medical, dental, vision, pharmacy, stop loss. They will assist us in any way under contract that we request in terms of the management of all of our programs and services. They will help assist us with setting the premium rates for the upcoming year, the overall management of the vendors that we have. They do not get commission, however, and that's an important thing for you all to understand, of our self-funded ASO arrangement. So anything with Cigna related to medical, dental, vision, stop loss, or pharmacy, there is no commission built in, and it is specifically excluded from the RFP as being a product that they can get commissions from. So that's important. So other things that they do is that they will assist us with legal questions that come up. They will assist us with, what else? Jump in.
Complicated HR questions.
Yes.
Strategy development
Training.
plans, trainings, et cetera.
So is that sufficient? Okay. So if you'd like to go ahead, Mr. Diaz.
Thank you, Mrs. Street. Thank you all. I truly appreciate the time today. First, I'd like to introduce a couple of my team members. Todd Harrison, who will be the lead consultant director at Willis Towers Watson, and then also Kelly Derrick, who is also our director of client management. So, thank you.
And
With
can I
that,
interrupt? Does it sound like his microphone is working? Can you tap the microphone, please?
yeah, it works. Can you hear me?
Yeah.
Can you hear me okay? All right, thank you. Well, it's a privilege to be here today. Let me say that. We've had the pleasure of working with Ms. Street and her team for the last 2.5 years. We've seen a lot of great things. The county runs very, very well. We understand the magnitude of this decision today. Obviously, this is a big part of what you do. The spend on the healthcare side alone is around $80 million for Rutherford County, for those that don't know. And we take our job very seriously and that responsibility very seriously. So thank you again for the time today. So if we can, each of you have a presentation. The cover looks like this. Should be on your desk there. So I'll walk through this, as Ms. Street implied. Please feel free to stop me at any time and ask any questions. The worst thing to do is stand on this podium and no one asks you a question, right? You just keep reading to the microphone. So we'll start first with the agenda. So obviously our team, who we are, on page 2. How do we differentiate ourselves from our competitors, right? What is different about Willis Towers Watson? Our health management team, our wellness. We talked a lot about wellness today, so that's not a new topic. Rutherford County's always done a great job when it comes to wellness and their wellness initiatives. The RX Collaborative, we'll talk a little bit about communication and questions and wrap up. So with that, real quick, we'll kind of go to the team. So this is on page 3. We'll kind of a little bit of an infomercial about Willis Towers Watson. And we're 40,000 employees globally. We're 25 countries roughly throughout the world, but primarily domestically. We have 1,800 H&B consultants, 5,000 health and benefit clients in North America that fit in this market. And really, if you kind of look at Willis Towers Watson, we've gone by a number of names. Most of you may remember, if you've been around this Middle Tennessee for a number of time, Caroon & Black, Willis Caroon, Willis HR. But we've fundamentally been doing benefits in Middle Tennessee since the mid-1970s. As a matter of fact, Jake Wallace, who still has an office in our building, is a 50-year employee with Willis Towers Watson. So we're very familiar with Middle Tennessee, and we've seen the extraordinary growth and the real changes in healthcare over the last quarter century or half century. So a little infomercial about us.
Yes, I apologize deeply for this interruption.
No, it's fine.
Mr. Hafner, can you confirm, did Mr. Bowles leave, or is he? Okay. We are below a quorum at this point, and we will have to utilize the mayor as the alternative, which is permissible, but we are at 11. Is there anybody that is going to have to leave early today? If so, then we won't be able to vote, and we'll have to redo this at a later time. So. But you're not a voter. Are there any voting members who will be leaving prior to the end of today's meeting? Ricky, you're smiling. I think I'll be okay. I need you to hang in there, buddy. Okay. Thank you.
Continue?
Yes.
Oh, thank you, Ms. Street. As Ms. Street implied, we have 80 attorneys on staff. We have about roughly 25% of the market share. We're big. There's no doubt about that. But what we like to think of ourselves is a global company that delivers our strategy and our resources at a local level. Again, being here for over 50 years in the mid-state, having an office in Nashville for that period of time is really kind of getting us connected to the community. Again, 135 health management practitioners, so we certainly have the resources and the ability when it comes to looking at large markets like Rutherford County. Any questions there?
I have a real quick question.
Yes, ma'am.
You have a lot of statistics here.
Yes.
How many clients do you have like us, Rutherford County? Whether it be a county or a city.
Yep.
Within,
In
a
the state?
region. Not necessarily in the state, but if you've got, state
You
would
mean
be
managed out of
great.
their office specifically, or within Willis Towers Watson?
I'm thinking within Willis Towers Watson and then nationwide, and then if you can say, okay, Mary, and I got 3 within the Middle Tennessee.
I apologize.
I'm not drilling you down, just kind of give us a rough guesstimate, please.
A rough guesstimate. I know in the state of Tennessee alone, we have close to 30 So
That's good.
If I were to equate that across all the states, we have more and more states, less than some
And
others.
it allows us to know that y'all are not just coming into this and we're at the top of your list of going, oh, we have Rutherford County, you have us in 29 other ones, give or take.
Yes,
Okay.
ma'am.
If
Yes,
you'll
ma'am.
look at page 3 of the handout, it's the top question that was asked during the RFP, so that will provide you with
sorry
that
about that.
information as well. No worries.
Okay. So with that, I'll go to page 4. I don't know if it's titled or not, but this is your team. So in Nashville, we have 30 associates that work in our office, 5 of which are on the financial and analytics side. The other 25 are in the account management side. And then we have additional 5 consultants internally and 1 actuary. So if I look at the team, Todd Harrison, as I mentioned, he would be the client advocate. I'm the market leader for the mid-state. Kelly Derrick runs operations for our office in Nashville and Memphis. And then Hannah Wiles, who couldn't make it here today, is the client service specialist. And Ed Scott, who could also not make it here today, is the lead actuary for Rutherford County. And then if you look down below that, this is our subject matter experts. So this is part of what we do. We have subject matter experts who are tasked with certain areas that we feel are beneficial to not only Rutherford County but all of our clients. So whether it's health management or senior communications and or as Melissa Mistreet mentioned earlier, with our NLRG or our legal resources, and then Pam Murray, who assists us on the HR consulting side. So all of these are available resources for Rutherford County and work on our team. So with that, we'll go to page 5. It starts at brokerage services. So this is how we work with Rutherford County. So if we look at this, as a client, you have access to our full suite of services, and it all starts with our broker and advisory services. So strategy, when we're looking at Rutherford County, working with Ms. Street and the mayor, we're trying to find out, what are most important. Obviously, cost, benefits for the employees, and also, what does that look like long term? What are others in not only Middle Tennessee, but in the state of Tennessee doing that may be beneficial to Rutherford County and their team? So when we look at this, we're looking at strategy, financial and data analytics, account management, renewal and placement, implementation and enrollment support. So that's how we work day to day with Rutherford County. The second piece is, as I mentioned earlier, is our subject matter expertise. And all of our subject matter experts have at least a minimum of 20-plus years experience in their industry. So if they're in HR, then they've been doing HR for over 20 years. If they're in communications, they've been working with communications for over 20 years. And all of this is a value-add resource to Rutherford County. So if there's a question that Ms. Street or team may have in regard to, hey, I'm not sure exactly how this should be handled legally, then we can put the summation together. Of course, we can't work on your behalf as your attorney, but we can cut down on the work that needs to be provided, right? So the hours that you would have to go back and hire an ERISA attorney are reduced drastically if we give the opinion upright. And then obviously, as I mentioned, the health management, which is back to the wellness program. Obviously, Rutherford County has done a very, very good job with implementing their wellness program over the years, and we're just here to kind of make sure that we're following the analytics. Is it best in class, which we know it is, obviously, given the award that Cigna provided today. But then on top of that, what are others doing, right, in the industry? And how can you benefit from some of the ideas that may be coming from some of those other industries? The second piece is our collaboratives and our resources from that standpoint. So we also have pharmacy collaboratives and pharmacists on staff. So if we know of specialty medications and they're looking at certain drugs that are going to hit the market, then we know what that responsibility may be to Rutherford County long term and the cost and the steps to implement so there's not abuse in certain cases. Obviously, stop loss collaboratives so that we're ensuring that you have the best possible stop loss coverage at the right price. In addition, we have audits that we can perform on behalf of Rutherford County, and then global benefits management wouldn't be a use for Rutherford County, but we do have those specialists available. Our benefits delivery model is more about marketplace. A lot of people have heard about exchanges. We do have an exchange, but this isn't something that primarily that Rutherford County may be interested in, but the resources and what other companies are doing in regard to that may be an advantage to know how are they communicating. You know, technology is a big piece of what we're seeing changing in the healthcare space today. How are people being communicated to? What do they value out of communication when it comes to healthcare benefits, and how do they own it ultimately? And then obviously assessing voluntary benefits. We just went through an RFP this year, changing vendors on the voluntary benefits side, which was an advantage to Rutherford County. It was lower cost premiums, et cetera, and it went well. But those are some of the things that we can do in evaluating your program, is ensuring that you have the right partners at the right cost. Any questions? Okay.
I have a question for Lee. He's begging for a question.
So we'll skip on to working with Rutherford County on page 7. Kind of what we know are some of the hot topics going on in the industry today, right? Pharmacy management, you probably hear about it all the time. I happened to be in D.C. a few months back, and used to be the NRA was the biggest lobbyist group in D.C. Not anymore, not by a long shot. The pharmaceutical companies and PBMs are certainly the head of the table these days. And there's a reason for that. Obviously, the cost and the magnitude that come with these programs come at a hefty cost to most people. So our job is to obviously ensure that Rutherford County has the best possible pharmacy solution in place. We kind of talked a little bit about the Cigna Wellbeing Program today. There's not much else that can be said there. I think what Ms. Street and the team have been able to accomplish here over the last few years has been beneficial to the county, and we'll show you a little bit how that's affected Rutherford County from a positive standpoint in a couple of slides moving forward. But I think it's important to know that all these initiatives, people talk about wellness programs, is their ROI. I don't think there's anyone out there who can equate that and put it down on a piece of paper, but we know inherently there is a lot of value in having wellness programs. And when you have a mayor who is willing to put themselves out there and really be a part of that program, it really gets everyone energized to be a part of it as well. So we obviously take that very seriously, and when we're looking at wellness programs, we'll find some best in class, and if there's anything that we can share that would benefit Rutherford County, then we try to bring that up in our meetings. Access and delivery, you already have the clinics. We have talked about the review of the clinics. I think there's an RFP coming up, I believe maybe next year on the clinic. So we would be a part of that process and evaluating that with you. Willis Towers Watson does have our own clinic area. We have 20 people who staff that, former doctors and physicians and nurse staff, so they know exactly what it takes, what it costs, what are some of the benefits, what are some of the things that you can do to ensure that program continues to create value not only for Rutherford County but for its employees. And then we talked a little bit about the HRA programs and how people are moving from one plan to another. We obviously assess that as well. What we're seeing a lot of today that maybe Rutherford County we're talking about looking at in the future, well, we talk about it in our meetings, but the health savings accounts. We do HRAs, which are more reimbursements accounts where we hold the money as Rutherford County. HSAs are dollars that are actually funded to the employee that they have access to regardless if they're an employee of Rutherford County or not. There are inherent values in that, and there's a downside to that as well. And we continue to assess those with Ms. Street and her team to look at what is the value long term, and is it something we should consider in the near future. And then obviously navigation and support. We were looking, I can't remember, was it Benefit Focus? Benefit Focus a couple of years back. We were close to, as a matter of fact, passed, we were going to implement that program, but then there were some issues in integrating that into what we were doing. So I think we stayed with ADP at that point, and still with ADP today. But our ability and our resources, what we do is we vet out the best possible vendors and third parties for you, so that we don't have to bring 20 people in here to say, hey, yeah, you need to look and listen to every one of these. You'd be tired, of hearing the same old thing over and over again. So we have a team that supports us, and they basically vet out the top in class, the value that they bring to our clients, so that we're not parading 20 people through here. And then the last piece is behavioral health. This is an issue, I think most of us heard it if you've read a paper or watched the news. Behavioral health is a big part of not only the claims component, but how people are actually being productive at work, right? If you have people in behavioral health or depression issues, then they're typically not as productive as those who don't. So we're looking at innovative ways and solutions to get these people in a better frame of mind long-term, so that they can function at a high level, not only at work, but through their families and with their families. So those are some of the emerging trends that we're seeing in the marketplace today. So on page 8, what are employers doing? So as I mentioned, pharma seems to be the biggest piece, right? And I think the statistics, the last one I read is by the year 2022, that pharmacy spend will be close to 35% of your total medical spend. So for us, we're talking about $24 million. 5 years ago, the typical spend on pharmacy was around 10 to 15%. We've been able to kind of stay steady here at Rutherford County, but we know that with all the new breakthroughs in medications today, that we will see an uptick on that pharmacy side. And what we're doing is we're working with our partners, our Cignas, and others to ensure that we do have the best possible AWPs and the best pricing and contracts in place for Rutherford County to compete as they continue to move forward. The other piece, obviously, we've talked about well-being. The programs that you have in place with Cigna today are some of the best, and I think that partnership with Ms. Street and her team and Cigna have created a lot of windfalls, and then obviously the negotiation of the contracts have allowed us to really keep the cost of those programs to a minimum for the most part, but creating a lot of value for the employees and their families.
Mr. Diaz,
yes.
I don't mean to interrupt.
No, ma'am, please.
You got roughly about 5 minutes on your presentation.
Oh, okay.
Then we'll have
All right,
questions.
yeah.
Then I don't mean to rush you, but
No, ma'am. That helps me a lot.
gotta make it fair for everybody.
They were supposed to tell me that.
That's all right.
So real quick, I think, if I go to page 9, insight, solutions, and values, our job, this is our job in a nutshell. We have some of the largest database of analytics when it comes to healthcare plans. So we're not only looking at municipalities or government entities, we're also looking at demographics and geographical areas as well. So when we're looking at Rutherford County, for one, we know that Middle Tennessee is a very difficult place to recruit, only because it's less than 2% unemployment. Doesn't mean it's not a beautiful place to live, it's just very hard to find talent in the mid-state right now. And so when we're looking at analytics, we're looking at, how do we continue to keep these employees here for long periods of time, and we know that the millennials have, they tend to jump from job to job. So our job is to, in essence, educate them on the value of our benefit program and what that means to them. So we're always looking at benchmarking and data analytics so that we can come back and find solutions, and from those solutions, create value for Rutherford County long term. So our job is to say, okay, here's what the market is saying, here's what we're doing, here's the inherent value long-term for Rutherford County. So page 10, 11, I'll kind of run through this real quick because it talks a little bit about the health management. At the top, it says 5% of the population represents 50% of the total medical costs. Well, in our case, that's pretty much true. 5% of our population makes up 54% of our total medical costs. And as was mentioned before, Ms. Street, cancers, neoplasms are always typically near the top. And in our case, they're always in the top 3. Our top 3 are cancer, heart-related issues, and then musculoskeletal. And that's very common given our demographics and around, median age around 40s, mid-40s. So our job is obviously to find solutions in that area, and we do that through analytics. So if we can kind of take a look on page 12, some of the benchmarking surveys that we have available for Rutherford County, which would include municipalities as well. So when we're doing this, we have a healthcare financial benchmarking survey that comes out every year. Typically, we put the data in from Rutherford County, and then it populates information on how do we compare to other municipalities, not only in the state of Tennessee, but throughout the country. We also have the best practices in healthcare survey. This is another one that's at no cost to Rutherford County, but provides you with analytics so that you can best make a decision when it comes to your health and welfare benefits. On page 13, real quick, is just a little snapshot of what that looks like. So when we're looking at companies, we're really trying to get down to the basis of we try to take out plan design, age, and gender so that everything is comparable, right? So when we're looking at the best-in-class companies, we're looking at everyone apples to apples, so that when we come back and say, hey, we recommend this, it's based on what we know is apples to apples with those organizations in your industry. So we can say we're 3% in this example. It shows a 3% less efficient than maybe somebody, the state, for example. Their program may be 3% more efficient. And we can kind of pinpoint that and say, okay, here are the solutions that the state may be providing that we should be taking a look at here at Rutherford County. And on page 14 is another example of some of the risk stratification. I will say effective January 1st, Willis Towers Watson we've worked with HDMS, which is Health Data Management Solutions, for a number of years, but we've signed on to do a national agreement with them. And really this is population health management, where we're taking analytics from Cigna and the clinic, and we're merging them together so that we can really highlight and control our costs based on any segment. So if that's diabetes, then we can create and look at diabetes management, and we can look at a group of individuals and say, this group of individuals is getting better, or this group of individuals is getting worse, and what can we do to help manage this process moving forward. So that will be available to Rutherford County at no cost, effective January 1st. And then page 15 kind of walks through the trend. If you look here over the last 3 years, 3.5 years, Rutherford County has been able to beat trend. So if we follow the black line, that's the trend, at national trend. And if you look at the red line, this is Rutherford County. So in essence, all the programs that Ms. Street speaks about, so the wellness programs, the initiatives that have been done there, the spousal carve-out that took place back in the latter part of 2016. All of those things had a great benefit to the county overall over the last 3 years. So the idea is not to blow anything up. The idea is to maintain that level, right, over a period of time. So our job is to ensure that we're using the analytics that we have. We're working closely with Ms. Street and her team, that we have the best in place, the best strategy in place to continue that trend line going below the national average. And so, time check, another one?
Yeah, I've got time's up.
Time's up, okay.
Sorry about that.
No,
I
it's quite all
have
right.
to cut you off there.
No, yeah.
But we appreciate the presentation. Now we'll open the floor for questions and discussions for Willis Tower and Watson on their part, and then once they finish up and y'all are comfortable with questions that you've had, then we'll dismiss them and bring the next group in.
I'm sorry, can I make a comment first?
Yeah.
So Well, if you could, you went over what the services were and how you support that. I'd like for you to talk, and Kelly, whoever's best to speak. I mean, I've worked closely with them both, but I really would like for you to kind of talk about the relationship with Rutherford County.
Yeah.
And, you know, are we being led, are we leading, or are we collaborating? That's kind of what I'd like for you to speak to and address, you know, kind of the broker's role from that perspective and kind of clarify for them within my role and responsibilities. And I'm asking you to speak honestly, you know, how I have interfaced with you all and kind of what you've experienced working with Rutherford County as a client.
Yeah, and I'll just speak for myself, and I'll let Kelly come up, because I think Kelly's certainly had a lot of day-to-day interaction with Ms. Street and the team. I will say this, that collaboratively, Ms. Street and the team are great to work with. They understand employee benefits, and you don't find that everywhere. And you typically find some people who are good at HR, and they just happen to dabble in benefits. What we found at Rutherford County is that, you know, it's easy when someone knows, you know, the inner workings and understands the changes in the laws and how that affects their group and their team at Rutherford County. So for me, it's been more of a collaboration, just kind of bouncing ideas off of Ms. Street and her team to say, okay, here's what we're seeing in the marketplace. Do you agree this would be a good fit for Rutherford County long term? And she has that inner knowledge of knowing, yeah, we've looked at that 2 years ago. We're not going to do that again, right? It doesn't make a lot of sense. And so for me, it's been a very, very good relationship. It's been easy to work with, easy to bounce off ideas, very collaborative. And I'll let Kelly come in.
And I would just piggyback on what Lou said. It's definitely a very collaborative relationship amongst us. I feel like Melissa and the team, Ms. Street and the team, have some great ideas that they bring to us, the same as we have some ideas that we take to them. So we kind of go back and forth with each other on that relationship. But yeah, as a day-to-day, I mean, we're very supportive of the team here at Rutherford County, and we're available whenever they need us. And I feel like it's just been a really good partnership over the last 2.5 years.
Question.
Ms. Stevens.
Sorry.
I just wanted to ask, and I'm sorry, of course, it does tie in with your presentation, but it's not what just happened. But did I hear you right, or did I mishear you that before I thought that the Ben-Val analysis was not part of our package? Did I hear you to say that it is part of it?
Oh, if we go back to, what page was that? Yeah, the Ben-Val is, we don't have that in it. It's available, obviously, but it's not part of our core services. So for a fee, obviously, we could do the Ben-Val.
What did you say was going to be effective January 1?
That's the HDMS. So that's where we're taking that's where we're taking the clinical data from Cigna and from Premise and putting that into our data analytics platform, HDMS, and it's a monthly report versus the clinical report, which we just reviewed with Cigna yesterday. So that's more of an annual report that comes out 90 days after the year ends, typically. So with HDMS, we'll have the ability to actually monitor this on a monthly basis. So we can check and watch how people are progressing one way or the other through the HDMS system on a monthly basis, if need be. And typically, most clients would like to look at that either, you know, every other month or quarterly.
One other thing, Mr. Diaz, can we talk about the financials for just a moment? Yes. So in preparation for today's meeting, I had requested, at the direction of the mayor, to include as part of the discussion today TCA code as it pertains to rebating. And so the way that they drive the commissions is off of products other than what I have already excluded in earlier discussion. So that's going to be your voluntary products. Some of those would be, so the long-term disability, short-term disability, life.
Mm-hmm. Correct.
That's really where you're driving.
That's the only part, yeah.
Currently the revenue that you're receiving.
Correct.
Now they're getting additional commissions off of ancillary products, so that's your critical illness, cancer, those products as well, which is not included in either their last bid or their current bid proposal that they have in place. And so of that bid that they currently have of $195,000 a year, that's somewhat of a moving field because it's all contingent on enrollment. And the enrollment and the salary levels and other things that drive the total value of that plan, and then ultimately their commissions, okay? So there is a true-up process that occurs. And of the true-up process, it basically says anything over $195,000 that they collect in premium from the allowable products will be utilized for the benefit of Rutherford County. And so...
And its employees, so that's important.
And its employees,
yeah.
correct. So talk about what that looks like and how that complies with the TCA code of rebating.
Yeah, so rebating is obviously when you're taking commissions in favor for a relationship, for example. So if the mayor would come to me and say, hey, you need to give me $50,000 to have a spot to be a finalist in this presentation, obviously that would be a problem. It's no different in the commission world. So if we receive commission, we can't turn around, let's just say that our arrangement ended and we had a surplus of commission, right, of $30,000. I couldn't turn around and write a check to Ms. Street in Rutherford County for $30,000. That would be considered rebating in the eyes of the IRS. So what we do is we create what we call a benefit bucket that allows us the ability, as long as it's used for the benefit of the employees and Rutherford County, that we can use that to offset any of that additional compensation that we've received. So in this case,
BenVal as an example.
BenVal as an example would be one of those that we could use those excess commissions to pay for. The one thing that we can't, that's kind of come back quite a bit for us, is like compensation studies. So if you wanted to know, what the compensation is, you compare to another municipality in the state, we can certainly get that information, but we can't use commissions to pay for it because it doesn't necessarily benefit the employee at the end of the day. It benefits Rutherford County. But communications, the litany of communications, Ben Admin. So if we're looking at a platform on the Ben Admin side, then we can use any additional compensation to offset that. Any communication that goes out to the employee, incentives for employees, we can help fund those as well. Yes, ma'am.
Correct me if I'm wrong, but I thought in your initial presentation with the other group that led you here today, we discussed the compensation studies, and I thought that, and I may have misunderstood, that you could conduct a complete compensation study of all the positions in Rutherford County, because I know that we discussed that based on last year around this time, and I could have sworn, did I misunderstand?
Yeah, because compensation studies are, because they benefit the employer, not the employee, then compensation. Possibly, or it could be less money for them, right? I mean, ultimately. So that's the one piece. But I'll say this, that all of our services, if you were to walk and just buy Willis Towers Watson just for their compensation studies, all of ours are discounted because you're already a client. So it's certainly a lot cheaper than you would if you were just looking for those services one-on-one without being a client of Willis Towers Watson.
So in your proposal, Mr. Diaz, let's say your commission comes out to $175,000.
Yeah.
What happens then, since you've bid $195,000?
Correct.
So what happens? Do we owe you that difference?
Yeah, I mean, no, because we work off good faith, right? So it's, we expect that, 1 year it may catch up if we're still involved. So let's say, for example, that we have a 3-year commitment with Rutherford County. The first year we get $150,000. We're not going to come back and bill Ms. Street for the additional $45,000. We're going to see if anything changes in the next year that ups our commission, and then we may talk about that at the end of the term. but we're not in a position ever to come back to our clients and ask them to write us a check. We know going into this, we feel like there's enough commission in there. If it falls a little bit short, we understand that's just part of the process.
And your commission proposal is really based off of your expected participation in the products that drive your commissions, correct?
Correct.
Okay.
All right, do we have any more questions for Mr. Diaz? Yes, Ms. Allen?
In the back of the RFP assessment that we've got, there's a line for additional fees, and it says excess currently $45,000, not inclusive of all for the A&E mailer. What is that?
Hold on just a second, Ms. Allen. They don't have a copy of that. They have seen it because
Oh, yeah.
I did email it out and make sure I'd captured everything correctly for them. So they have seen it from that perspective, but
Second to the last page.
Second to last page. Oh. It says currently for.
You saw this in the
inclusive of all costs of
RFP part of it?
Yeah. Yeah, so what are we doing with the 45,000? Is that what you're asking? Well, that's the point. We have the ability to do whatever Ms. Street and the team feel is a good use of that money, again, as long as it benefits the employees of Rutherford County. Yeah, the audit was initially what we had talked about, the RX audit at one point, and certainly that's still something we can do. But the intent is to wait for this decision to be made and then figure out what may be the next steps for using this money and the timing around that.
All right, any other questions? I'm sorry, I'm making notes. All right. Thank you very much for your time, and we appreciate it.
We truly appreciate your time, and again, it's been a privilege to work with Rutherford County, and we hope we get to continue that relationship moving into the next 3 years. Thank you again for your time.
you just leave it up there in case we refer to it again. Thank you, Lou.
Welcome.
And just to kind of let
Thank
them
you
know
all.
as they're leaving in our committee here, what we decide goes to budget in December, and so it'll go to full commission for final approval at the December meeting. So just to have the new folks knowing how we go from our insurance committee to the budget committee, and budget takes it to full commission. So we meet at the end of the month for the next month budget meeting.
We're going to bring in Mercer now. Oh, they have some helping hands there. I was going to help hand out packets. Thank you all. You're welcome to come up here, Mr. Brown. Ms. Martin.
All right, we'll give them just a
You all would
couple
like
minutes to hand out.
I will let you know, Mr. Brown, that you will be given 20 minutes to speak. We will time you, and the chairman will let you know when you're 5 minutes from end, and then question and answers will be allowed at any point during the discussion. We need one more for the
If you've
mayor
got
when he
one more,
returns,
Jay.
please.
Some extras.
Just
We had
lay it here in the mayor's stuff.
Because he won't get one of these, he'll get this. Just this. There's the mayor.
All right, Mr. Jay, if you'll give me just a moment, me and Mr. Ketron are going to switch seats. We'll let him
You'll need
finish
to track
chatting.
time. You'll need to track the time when they start, please.
I've got stuff everywhere spread out, so. Not individual. Everybody get a packet? We got one.
So we're at 3 o'clock, Mr. Brown. If you'd like to begin, we'll let you know when you're at
All right.
3:15.
Ms. Stevenson, we want to do some jumping jacks and warm up. I know you said you were cold. 2 degrees.
I can feel it.
That's why I wore my sweater today, because I knew it was a little chilly in here, and I know y'all have been here for a couple hours now, so if you can bear with me for 20 more minutes, we'll get you guys out of here, hopefully. So I'm Jay Brown with Mercer, and Jolene and Yina are also with us. They'll be over there and available for questions if you guys have anything. And really what I put together for you is a folder of information.
Brown, please make sure that you speak into the microphone.
Yes, thank you.
Thank you. You can lift it up a little bit if you'd like. That may make it easier for you.
I was thinking it was a hand holder, but I'll stand here. So what I tried to do, because I know we only have 20 minutes, and I want to be able to be a little flexible if you guys have questions, is I put together a placemat that has about 12 of the slides we would normally go through on the front and the back that I thought would be the most relevant for this presentation. And then I realized some of the slides are a little small, so I do have some handouts that I'll kind of walk through as we go through there, that you'll be able to see this a little better. So I'll go through that as we go through. As we prepared for this meeting, I will say, one, that the committee did a great job. I think there was a subcommittee that was put together. The RFP process was very thorough and complete. That gave us a lot of information about, really what you guys were looking for as you're selecting your broker. You've asked a lot of good questions through the process, so I could tell you actually did read our answers, which a lot of people don't. So I do appreciate that part of it as well. And really in doing that, going through that process with the subcommittee, also going back and looking at some of the YouTube videos that y'all do and the minutes, and then some of the questions from that, it helped us kind of prepare what we think to be the top 4 or 5 things that we wanted to address today as you guys are looking for a new consultant or reviewing your consultants. And I put that at the top of the placemat. So the 4 areas that we really want to try to cover in the 20 minutes we have is what we see is looking for a consultant or a partner that's going to be both local, but also have those national or global resources available as well. The other part 2 of that is a proactive service excellence. So, really a good, strong service team that you can trust as you're, making your decisions. Actuarial and financial rigor, that's something important to me as a former underwriter with Cigna, which we'll talk about a little later. But the numbers, I think, a lot of times tells the story that you're looking for. So we'll dive into the numbers in the presentation today. And then really the last thing is a clear strategic direction. So what we want to be able to do is sit down with you guys at the end of the day and put together a 2 or 3 year strategy based on your claims data, based on the direction you're wanting to go. And really that'll be the 4 areas that we really try to touch on today, if that's okay. Does that sound about what you're trying to accomplish? Is that 4 things? If I touch on those, we'll at least be in the right direction? Good. Well, as far as local, I'll say I'm a native Nashville, so I'm one of those unicorns like some of you guys. Also a graduate of MTSU. I still say MTSU. I know some others say Middle Tennessee. Still on the finance board with MTSU, so know Dave Wood and those guys over there. We recruit from MTSU in our finance team. So, when I look at Middle Tennessee, it's near and dear to my heart. It's where I'm from. I feel like I know your employees. I feel like this committee here, it's important. What you guys do and the decisions you make affect the residents of Murfreesboro. And, we've had the fortunate, me personally, through the years of working with Murfreesboro City. So I've worked with Shane McFarland, the pharmacy. So Shane Reeves worked with those guys, SVP Worldwide and Quanta. We've worked with a lot of groups here in the Murfreesboro area. And it is important. The people that you're making decisions on, hardworking individuals, a lot of them live paycheck to paycheck. Benefits are very important. So I just want to know, as I realize as you're making this decision, is that when we select plan designs and carriers and contribution strategies, it's an important decision, not only for your residents, but also for the taxpayers of the county. So I want to first kind of read off with that. Also, we put together a local team, so I'll be the lead consultant for you guys. I've actually worked with you before. I'll get in that a little bit later, so I know a lot about your plan. Una Martin also has worked with you in the past. She was with me in a former life. Jolene actually worked with you guys a long time ago under Tom Provost. I don't know if you know that name, but she worked with Tom a long time ago. So what our goal a little bit here is to put together a local team that one of the handouts kind of shows that. So in the dark blue, put together a local team of the 3 of us, a financial analyst, a wellness coordinator, our office manager, and then in the light blue over to the right, experts throughout the region. So we'll get into those a little bit later, but I think that's the key, as I said in that first point, of driving home the fact that as some consultants are going more regional, where a lot of the services are handled out of Nashville, it's actually handled out of Atlanta for our clients. One of the reasons I moved over to Mercer about 3 years ago is Mercer really wanted to invest in Nashville. Yeah, all the cranes that we saw down there, I mean, we're on West End. They really saw the growth several years ago coming in this market, and we've tripled in size in our staff just in the 3 years that I've been at Mercer. To the point now where, our average client size, or I guess accountant to client size is about 5 to 6 clients per consultant. And then about 60% of our book of business is right in the size of where you guys are. So, I mean, we're a national firm. We're the largest global firm. And with that, we typically work on groups more of your size, self-funded. And typically, there are complex accounts. And so that's why one of my commitments is I wanted to really have a team that's not working on 15, 20 accounts each, because there's a lot of work that goes into self-funded clients. Any questions about any of that so far? I knew you would. That's why I was giving you an opportunity.
Thanks for looking at me. You knew I was going to ask. Just to make it fair, can you rough guesstimate within Tennessee, or who do you help like us? Who do you help like Rutherford County that is self-insured and things like that? I don't have to have it pinpointed down, but,
Right.
I got 2 or I got 22 or what? Just kind of give us an idea of who else do you help that is managed and run like our Rutherford County is.
Well, that last part you added on there was a little, I don't know about that part, but as far as size and self-funded, I mean, we work with Shelby County Schools, so I mean, I think that's another one that probably has a similar process. One thing I did leave out is not only do I know your benefit plan that we'll get into in a second is working with you guys, but I also know the process of going through the insurance committee and then the commissioners and, how you go about that, and that would be something similar to Shelby County Schools. Another, I wrote down a couple. I mean, Lipscomb University is another that we work with, so they're another, school system that's here in Middle Tennessee. I would say others, I would say that we gave, I guess, this was a question that was brought up too. Nissan is one of the references we gave. So Nissan's one of the big employers in Rutherford County like you guys. Also uses Premise as their on-site clinic, MedPoint. So that would be another very similar as far as when we get into wellness. How do we kind of use the wellness piece with the county, similar to maybe Nissan. And then I will say Premise is one of our clients as well. Hopefully we see that as a good thing because we do a lot with them as far as some of the innovation. So that would be another. But then either small ones, Webb is one of our local. I mean, so it's small, but it's still, the way I look at it, when I was asked that question before, is I could give a list and say Mercer is the largest national firm. We have hundreds of counties and school systems across the country, but really I look at it as what are we doing in Middle Tennessee? What is this population? Because a lot of times you're competing for talent in Rutherford County as you're putting together a benefit package to retain and recruit good teachers. So, how do you look at that? So I can provide, I think I gave some bigger numbers to Ms. Street, but I can give you more. But that's a few in this area that hopefully that answers your question. Along the same lines there, on the flip side is what we really want to make sure we dive into is that we are a large firm too. So I don't want to overlook that we're local, but we also are large. And on the placemat, I put together really 2 slides up the top left and then in the center kind of saying because of our size, we know the carriers. We're one of the largest nationally with Cigna. A lot of my team actually came from Cigna because they have a big underwriting practice here in Nashville. I came from Cigna. But also we have, a big business with Blue Cross. We're the top in the state with United Healthcare. So I know you guys are going out to bid next year. Not that we plan to do anything, Cigna, I see you grinching. But in general, want to make sure when you look at that, you're with a firm that's going to be, neutral, have leverage with those other providers, be able to talk about their services and their capabilities, what their wellness initiatives are, what are some of their programs, and that's something you would get from a Mercer. The other part of that is when we have down here the purchasing power. Reading through the minutes, I mean, the stop-loss renewal was a little tough this year, looking at that earlier in the fall or in the spring. That's something kind of in that middle space is we run all of our stop-loss proposals through a hub. So because of our size, you can kind of see down there, we have 4 stop-loss coalition partners that we can run through, and we use our size for leverage there. So that's something we would want to look at as we're looking at those services. Along the same line in the middle, Pharmacy is a big thing, so when we look at that, we have our pharmacy collective, and our three main partners there for a PBM is ESI, CVS, and Optum. So we would want to look, when we're using our leverage is, what does the Cigna plan offer? And then what are some of these other national partners that Mercer has available? How do they compare, and how can we use some of that leverage? So I won't go through all 8 of those icons over to the left, but when we start talking about why would you go with a national firm, those are some of the things that we talk about. And because you're down to us and Willis Towers Watson, we're number 1, they're number 2. So to be honest, all the things that Lou was just in here talking about, we do all the same things. So I'm trying to figure out some ways to be a little different in the conversation today. But a lot of those things I think in this first slide here are important, and we'll touch on a few more. And I think we'll probably end on transparency. I think that's another part of ours is, with our pricing and our funding, we're very transparent on our fees and commissions and stuff like that. So I'll end probably with that. I know there's some questions there. I kind of touched on that middle section, but just kind of going through there, I want to make sure we do look at these things. The best thing I'm excited about working with you guys is there's not an RFP due immediately. So, when the committee put this together, looking at the broker side, it really is a good time, because what happens immediately after this is you start budgeting. So there's budgeting, setting contributions, contribution strategies, but there's not any RFPs due immediately. So that gives us a little bit of time to get reacquainted with you guys. But then in the fall, you've got a lot of things that are going back out to bid. I saw the list in the RFP, but you have the medical, there's some life and disability, there's some other stuff that's coming out to bid. So I think one of the things we want to lean back in on, as I said, is the knowledge that we have of working with you guys before. Will really play into that part as, there shouldn't be a huge transition. But shortly after setting those contributions, we will really be diving into that RFP process. And I think that's where we'll be able to use a lot of these kind of resources we're talking about, some of our global strength to make sure you're with the, the right ancillary partners and things like that. Any other questions there? Good. All right, kind of going down through, the second part of this is proactive service excellence. One of the main things when I moved over to Mercer that I wanted to put in place is that, we have 3 different silos. We have consultants, we have day-to-day account managers, and we have a financial team. And we've built that out over the last few years. And essentially, we have a team of financial analysts and a lead analyst, and we have some actuaries as well that will review your numbers. And as I said earlier, I really do feel the numbers tell a story, especially on a 5,000 life group, $75 million in premium. This is a lot of dollars that we're talking about. And so one thing we want to make sure is we're looking at those dollars, helping with the finance team you guys have to make sure we're setting budget and the contributions correctly. We make sure that we have 2 sets of eyes on everything. So, if there's hopefully never going to be any errors in what we do, because somebody does it, somebody reviews it, and then I'm out here doing the presentation. So at the end of the day, I'm kind of the last buck stops with me in presenting this. And as a former underwriter, I want to make sure that I'm presenting the right things to you. So you've got the financial team that we can feel strong that the numbers are right, because I know if the numbers aren't right, typically we're going to get fired. So that's important. And then account management. We want to make sure we're returning your calls timely, that we're working with you, that we're coming out to the different committee meetings. And that's really where these guys come into play, is making sure, we're working with you from a compliance perspective, addressing all the strategy and questions you have throughout the year, retiree needs that we've talked about, communications. There's a whole calendar that we put together that's a 12-month calendar that we're making sure that we're hitting all those benchmarks and milestones. But at the end of the day, once again, if we don't return your calls timely, if we aren't answering your emails timely and comprehensively, we also typically lose our clients. And then thirdly, the part where I get to come into is I get, as the office leader, as the lead consultant, I work on a lot of the larger clients that we were talking about, and then I'm on conference calls nationally with other large clients. And so you're getting the freshest ideas that across the country that we're talking about and working with other clients of your size. And really, that's where I see kind of that next part down at the bottom, the circle value, quality, results. What we really get the benefit of the timing at the moment, if you or decide to move to Mercer, is immediately we get to come in and sit down with you guys and really work on this 5-step process that we work through with all of our clients to kind of go through literally steps 1 through 5 there of understanding, come together with a strategy, talking to you about what we're seeing other people are doing, and then we'll get to put all that in place, hopefully for a 2 to 3 year period before we really start getting more tactical with the carriers and decisions like that in the fall.
Brown, you're at 5 minutes.
All right, good deal. Like I said, I've kind of covered local and global strengths. Proactive service is our service model, how we take care of our clients, how we've grown, tripled in size since I've been here, 5 to 6 clients per lead consultant. Average, we have 60% of our population is in groups of your size, so that covers that. Proactive service model, we actually have a template, so we come out, like we said below, and work with you here to kind of put together that strategy. Actuarial, financial rigor, that's really this financial team, but what I like about that I haven't talked about yet, and I put together another piece for that I think you'll like, is this dashboard. So, this dashboard essentially is something we provide on a monthly basis that I think Ms. Nolan will like, that essentially shows you when we set that budget first of the year, and then it's something I think Ms. Street kind of presents to you guys monthly at these meetings as well. We can kind of say the dark blue box here, or bar chart, is the budget, and then the light blue is kind of your claims, how you're running. So on a monthly basis, we're able to put this together for you to show you how your claims are running, how you're up against budget. Kind of the one in the middle here, the dashboard shows what's your loss ratio. So in that one, we kind of can see on a monthly basis what the renewal's going to look like. So if you're running at a 78% loss ratio, hopefully we're in more of a single digits. If you're running higher than that, you can expect more. So, in just a couple of these slides here, we can get an idea every month how you're running so there's no surprises. And that's one of the keys. We want to try to minimize the surprises for you guys. And then number 4, clear strategic direction. Most of that is really listed on the back of the placemat. Different things that we look at here is we really do feel that your claim data is important. And there's one thing to do the financial analysis, that's this dashboard we were talking about. The other part of it's the utilization. So we want to actually look at your claims. How are your claims running? I think in one of those, because stop loss was high, that probably means you had a lot of large claims. So what are we doing to try to get those employees out of the hospitals quickly? And so we have a data analytics tool that I also put in here to give you a couple slides on that, is our data analytics solution, Mercer Focus View. And so this is it's powered by IBM Watson. And so this is our data analytics tool that is provided in our proposal, that we would work with the medical and the pharmacy to take a deep dive into your claims. And really where we're starting to see the market move in a little different direction is looking at total health management. So what we want to do is look at your claim data on the back over to the far right and get the right results, is start looking over here is, do you have a high diabetic population? Do you have a population that has a lot of large claims? And how can we really put wellness solutions in place with some vendors either Cigna's using or possibly vendors that Cigna doesn't partner with to really drive those claims? Because really what we're seeing is, and typically 5% of your population is generating 50% of your claims. So how can we really adjust a smaller group, either through the MedPoint clinics or through some other vendors? And that's something I'm really excited about, is working with you guys on the wellness side. All right, that was my 20 minutes. Or
You have
questions? I'm sure you'll ask me some
You have
questions.
about 40 seconds. So I'm going to ask a couple of questions if the committee doesn't have anything immediately. One of the things that I would like you to discuss with the committee, and I asked this of Willis Towers Watson as well, for clarification, how many years did you work on this account when you were at Cowan Benefits?
I had down in my notes that I worked with you guys for 6 years. So I was really your first consultant in a long time that put together a lot of these programs we're talking about with you and things. But I think it was 6 years, and then I moved over to Mercer about the time you were doing the bid, I think, for a new broker.
So during that 6 years, can you explain how you have worked with risk management and what your experience has been from a broker relationship? Is it more of you're leading, being led, or a collaborative approach?
I was going to say, I think it's been more collaborative. I mean, that's the way I envision is that we've worked together, and that's the way I try to work with all my clients. I mean, I feel like I'm more of a teacher, so I like to come in and explain kind of what we're seeing. I think the team you have in place is pretty strong in the benefits, so we can work together, and I think these guys add a lot of value too. But I mean, the way I've seen it in the past is we come together with this 2 or 3 year strategy, and we do that together. But it's us bringing ideas from Mercer, and then you guys know your group better than anybody. Even though I've worked with you for 6 years, you still, for the school systems, you guys know, and then from your side. So I see it as being a collaborative decision.
And one of the things I'd asked in preparation for this was about the TCA code related to rebates at the request of the mayor. Can you talk about that? So one of the things, that we need to talk about is if it's excess of the premium quote commission quote you've given, how will you utilize that without violating the rebating rules?
Yes, that's a good question. And really, I think to go back, we're the ones that established the commission structure that you have in place back when I was working with the beginning. And really the 195, it's $195,000 or something that's been thrown out. That number is typically made up of life and disability products. And when my first sales pitch to you was, hey, you need a consultant that's bringing these ideas to work with you. Let's figure out ways where we can add value but not add cost to the county. So most of these products that we talk about are on a voluntary basis. So for the most part, the county's not paying for them. We took out RFPs. We were able to get rates lower than what you were paying today for LTD, STD, and life, and still have our commissions in there. So when this first came in place, we negotiated lower rates, which included the 195 or whatever that number would be. And the thought there was, one, it's not county money. When you divide 195 times 5,200 times 24 paychecks, it's about $1.50 a paycheck to the employees. So that's what that represents. And then also, these are typically 3-year rate products. So the life and disability are typically flat for 3 years, sometimes longer. And for the most part, unfortunately, we're not given a lot of raises. So the volume's staying around the same. So if the volume's the same, your enrollment's not really going, you're not merger and acquisition growing a ton. So the way I structured it initially, the commissions didn't vary that much because it was in those products. Now, what happens there, what I would say to answer that is if we saw that the commissions go up and we guaranteed it a certain amount, what we would typically do is try to lower the commissions in the next year. So if we thought if it was 195 and it went up to 205, we would tweak the commissions with some of those carriers to get the number down so that the next year, instead of 195, we're 185. And that's kind of what we've always done in the past. I think that's the easiest way. Other things we could do if we're over about $20,000, I mean, we could offer, a dependent eligibility. I don't know, y'all did that last year, and I think it's a lot of heavy lifting, but I think it had some good results. We could do some other wellness initiatives. So there's little things that we could do there to add value that may be out of the scope that we would call in our normal consulting. But my first approach would be to kind of adjust the commissions. Does that make sense?
Can you talk about your proposal? So in your proposal, you came in at a $645,000 over 3 years. Voluntary products, which is the current Unum, moving to MetLife, is not included as part of that. Your rate increase, if we expanded for 2 additional years, would be at 3% cap. The incumbent came in at $585,000 over 3 years. So there is a difference there between your proposal and the other. So what is it about Mercer that brings that additional value for, even though I recognize what you're saying, that this is not necessarily a large portion of county money, even though you will get commissions off of the basic life that the county pays for and the LTD. How can you substantiate that commission difference there in the services and offerings that we would get from?
Yeah, that's a valid question. That's why you do these RFPs. I mean, you want to look at the services and then what you're paying for the services. And I would say, also having that historical knowledge, when I was in a former life with you guys for 6 years, I mean, I'll be honest, the commissions were more around $330,000. That's what I think Cowan was making towards the end before I'd left. But at that time, we were also out doing over 100 open enrollment meetings for you guys. So we would go out to all the schools. I mean, literally, we had a whole army come out here in 2 weeks doing over 100 meetings, and that's not cheap. I'm very thankful to hear that you're not doing that any longer. So I think it sounds like from 330 to 195 sounded like a great deal. I would also say, you know, I really do, when I look at the core services, knowing the process that you guys go through, knowing what it takes of my team as the office leader for the whole state, I mean, the number really is closer to 240, I think. So it's not 340, it's not 195. I think 195, you're kind of, it's too low. And maybe that's come across in some of the services you've seen from Willis. I know in talking last time, the communication package is down. There's some other areas. So I think the number should be closer to 240. And then my sales pitch would be, you're paying $75 million in benefits. That's what your premium is that you're paying, that you guys are managing in this room, is $75 million. I'm hopeful that Mercer and the leverage that we offer, due to the relationships we have in this community, due to some of the things we've talked about in RFP, that additional $30,000 is worth it to you guys. I know for me, a lot of the things I've heard, I can guarantee that we can correct and do better. But I also realize you've got to kind of make the right decision. So I realize we're a little higher, but I do think with the additional services, the stronger financial team, the data analytics that we're talking about, the knowledge I have of the market, that it's worth that additional price.
Wouldn't be fair if I didn't ask you a question. One of the things that you guys had mentioned before was the employee benefit communication, some of the communication pieces that the risk management team would need. And I believe your comment is that you would work with the client to identify their goals. Would those communication materials and needs be provided, or would those be in excess of our current fees?
Those are included, and that's one of the questions I'd asked early on, because I know we're still, I believe, mailing packets to homes, which is expensive. So all the things that you're doing today would be included in commissions, but we'll go back through and talk. I mean, there is definitely some more technology solutions. I mean, I'm curious to hear more about what you're doing with ADP and the upgrade there that I don't know about. With some clients similar to you, we're doing more texting. So there's a whole campaign that we could do on how do you get personal cell phones in order to text, but that's a new area. And then we used to do the postcards with you guys. We've seen that it takes everything. It takes doing the benefit guide, which, you know, I like. I mean, the guide is nice, but doing posters and mailers are still important, because you've got a wide range of population of people. You've got millennials all the way up to people about to retire, and different people see things different ways. And so that would be part of that strategy, is what makes the most sense for Rutherford County. And I have a feeling it's probably a little bit of technology and a little bit of going back to paper, but all that, whatever we come up with, would be included in this price.
And just to confirm for the committee, your commissions, you do not get any commissions off of the Cigna medical, dental, vision, pharmacy, or stop loss?
Correct. I believe most of it's in the life and disability, and that's, we're not having any additional, correct.
Are there any other questions for Mr. Brown?
I think you were very thorough, Mr. Brown. Nobody has any questions for you.
Thank you.
Oh, Ms.
Yes, ma'am. You just thought of one.
Sorry about that.
We didn't get out of here quick enough.
He should know it's me. I meant to ask this when you were talking about it, the year-to-date, this pretty little everything.
Yep.
A question for you, and actually putting Ms. Street in it too. This would be a little added extra bonus to make your life easier on making the bigger reports that we get at the first of the meeting?
Correct.
Okay. So and this is pretty in color, and I like yours too, but it's like another set of eyes looking at our numbers, not just Ms. Street's
Right.
or Ms. Nolan's together. It's another set of eyes, and this is easily understood. We look at these others every month, and us in here kind of get it, but anybody that, average person walking in or whatever can see these. So I appreciate that, and I was just kind of making sure that they could live together and work together. Okay, thank you.
And I mean, I do a lot of these type meetings. For whatever reason, this is, out of everything I talk about, this seems to be the most, when we talk doing this, because I didn't have this at Cowan. We couldn't even put this together at Cowan either. But you're right, it's one page where it's something about the color and the graphs just help you get it better than the spreadsheets. So, all right. Well, thank you, guys.
Thank you, Mr. Brown. Other questions? Okay, Ms. Street.
So if you will look at the document that I provided you quickly, I would just like to go over the financial piece and share some additional information. And I know this meeting's been long, and I appreciate your patience and cooperation and participation in it. So if you look at the very bottom of the next to the last page, you'll see that in 2017, Willis Towers Watson received $164,145 in commissions, with net commissions at $146 after expenses. For 2018, if you'll go to the next page, you will see that net commissions comes in at $242,865. Now, the reason you see that swing is because when you add new products, so as an example, we're going to MetLife on 1/1, there's always a front-end load of commissions to the brokers. It's a typical model. So then over the next couple years of that contract, their commissions lower. So seeing that up and down in commissions is pretty normal. Here's the thing that you have to, I know that in everything else that we do, it comes down to the financials. And this is what I said to the group that did the reviews of all of the companies that submitted bids. 50% were buying the person, and 50% were buying the company. And the reason I say that is because the commissions are volatile because it's all enrollment based. And so they are all projecting what expected enrollment is going to be in these products and what the commissions will end up leveling out to be. So that's really where their RFP financial piece comes into. If you look at the marketplace, the insurance industry in Middle Tennessee is very, people move a lot. So as an example, Mr. Brown used to be at Cowan. Used to be at Cowan. Now they're both at Mercer. Heath Holt, who sold us Willis Towers Watson, is now over at Mercer. Mr. Harrison, that you saw here with Willis Towers Watson, was with Highland 3 years ago. So that's why I say you're buying the person and you're buying the company. You got to make sure that the company has all of the services that you need, but also you have to look to say, all right, who is driving the bus? I will say that it's my opinion that both Mr. Diaz and Mr. Brown have risen up to a point within their organizations that they'll probably be there both for quite a long time. So I can't foresee any movement with either of those two individuals. So one of the things that we looked at is when you look at Lockton and CBIZ, which were the two other companies there, the reason they weren't brought today is because they just lacked the local experience. Lee Cattell Roberts had no accounts. She used to be at Cowan, now she's at Lockton. She had no government accounts. CBIZ, the person that would be working with us, was out of Kansas City. They weren't local to us. There was an account executive sales type person that would come and participate, but the person that I would be dealing with on a day-to-day basis was actually in another state. Also, whenever we went through and we called some of the governments that they indicated that they had done business with, they were doing more payroll and not benefits. So based on those things, that's why those two entities were excluded. So that brought us Willis and Mercer today. There have been issues, as you all know, in the past with the performance of Willis, and I'll speak to the reporting. The report design that we have today was actually developed by Willis Towers Watson. We had enough issues with the financials being accurate on it that I had to pull that back in-house. So when we brought this broker relationship to the table, that was one of the things that they did as a service to us. They were having performance issues in that regard, and so therefore I had to bring it back in-house, and so now I do that report myself. So I lost some service there along the way. Personally, I like all the members at Willis. I enjoy working with them. They respond very well. Their legal is top-notch. They get back so quickly. And my experience with Mr. Brown was the same, with the exception of I just didn't have the errors. Open enrollment, we just had open enrollment. We had several people that didn't get their packets. The year before, packets weren't sealed properly, so we had documents that weren't in the packets whenever they received them. We've just had these ongoing continuation of those type of things with Willis, and if we're going to have a broker at the helm working with us collaboratively, we need to be able to trust the information that we're getting. I should not have to spot check everything that they hand to me. That kind of mitigates the whole purpose of why they're here to support us. So I'd ask anyone that was participated in the interview process initially, if you'd like to interject any of your comments or feedback. Mr.
Joe.
We handle a lot of bids at the Board of Ed, and our criteria is lowest and best. That does not always mean lowest. And I have shared some of Ms. Street's frustrations being in meetings as we were looking to assess where we were at getting ready to set rates. The employer pay in my funds is over $50 million. It is my largest expenditure after staff. And we had issues going into this process that made us not as comfortable as I would like to be in trying to predict something 18 months out to budget it. I'm, as you said, and I don't mean this disparagingly against anyone at Willis, but when we dealt with Mr. Brown, when he was at Cowan, we did not have issues like that. We may have had minor issues on some spread, but it was maybe once, but they were minor. And the underlying data we were very comfortable with. I think that's something, to me, that we need to keep in mind as we award this bid.
Yes, ma'am.
Making sure. Looking through this, and y'all stop me if y'all need to talk a little more, but I too, on our end, out at the Highway Department, do bids, and like you said, lowest is not usually, can sometimes not be the best. But based on notes that I've made today and speaking with them too, there is something, anything gives me heartburn that says additional costs may apply. That's on a couple of spots at the Willis Tower and Watson thing. And the big one, I believe maybe Ms. Stevenson asked about, is included in Mercer's thing. So with that being said, and yes, there is a cost difference, but if you look, the 4 and 5 year cap for Mercer is only at 3% and potential, and Willis Watson Towers is a potential at 5. So with that being said, knowing the errors that we have had, and we've had to bring a few things back and have them corrected on paperwork for documentation for public knowledge on those. So with that being said, I would like to go ahead and make the motion to forward Mercer on as the broker of record for Rutherford County Highway Department, or not Rutherford County, Rutherford County. I'm so used to doing highway department, for everybody, for Rutherford County government.
There's a motion.
I'd like to second that.
Have a motion and a second. Discussion. Commissioner?
Melissa, is there anything for you personally in your department that distinguishes one of these from the other?
It's the comfort level, quite frankly. Even with the errors that we've incurred, this is not easy today to do, because I know that Willis Towers Watson has worked very hard to try to meet all of our needs, and you know, the CAP report you'll see has good results on it, but it's that comfort level about the accuracy of the information that kind of stays with me. It's the redundancy of the nature of the issues that we deal with, like with the open enrollment materials, that gives me pause and hesitation. And like Mr. Sandvik said, we just didn't have those issues in the 6 years that we worked with Cowan. I will say, though, in fairness to Willis, Ms. Hickerson, there are going to be things that, even though it's not on this spreadsheet reflects how they answered the RFP and the questions. So as an example, if you look at Willis Towers Watson, where they've got described additional services, all of those things could be done at Mercer, and they're all going to be additional charges. They're not part of core services. But to that point, during the interview process with Willis, they talked about a lot of solutions that they had, whether it's analytics or, you know, different programs that they could use to infuse in our plan management. And repeatedly, I would ask the question, is this new? Is this something new? And the answer repeatedly was it was not. So even during the 2.5 years that we've had them, we've not even gotten an opportunity to maximize some of the solution and offerings that were at Willis that were never brought to us. And that was disappointing for me to hear. So I think it just goes down to just the overall comfort level based on past experience working with Mr. Brown at Cowan and our experience over the last 2.5 years. I do a lot more heavy lifting than I should in some areas with a formal broker relationship in place.
Other questions? Ms. Street, I had asked you when all 4 presentations were made, which company was it that talked about giving rebate back subject to state law?
Yeah, so they all talked about that, and that's why I had included in part of their presentation today about the TCA process and how would they true that up. And Willis Towers Watson said that they would use it to offset cost of services that were not built into their core offering. So as an example, and Mr. Brown used this example, dependent audit. If we wanted a dependent audit rather than us paying it out of our insurance fund, if there was excess, then they could cover that cost for us as part of that excess premium. Mr. Brown had said that there was 2 options where they could adjust their premiums to keep it flat and within the proposal rate, or they could do the services like what Willis had suggested as well. And all the companies that we talked with indicated that they would provide the additional services, and it's basically a line item transfer within their organization to cover things that we would typically have been billed for.
Okay. When they listed as rebating, I just have been in the industry for 45 years, and there's nothing in code that allows anything over $25
right.
For agents. So I would like some other clarification that they're going to take it out of what they own, not rebate it back to us to get the best price.
Right, and that's what they had both indicated, that they would, you know, it's not an opportunity to cut any check back to us. It's not an opportunity to, you know, leverage their popularity by, you know, distributing proceeds or anything like that.
I just want members to understand that. Yep. Okay, we have a motion and a second to accept Mercer. Any further discussion?
Sir, if we could, I'd like to do this by roll call.
Absolutely. We're spending money with that recommendation. All right. Madam Clerk, if you would call the roll.
Commissioner Allen?
Dr. Anthony? Ms. Buchanan? Yes. Okay. Ms. Crowell? Okay. Mr. Hafner? Okay. Ms. Hickerson? Yes. Ms. Kennedy? Okay. Mr. Marlin? Yes. Mr. Sandvig? Yes. Ms. Sherrill? And Mayor.
Aye.
So it does pass with 11 ayes.
Motion passes. This concludes our meeting today. Thank you, Ms. Street and staff. Thank you, members of the committee. I guess we'll go ahead and get this on to the December meeting, I guess.
Yes, sir.
Okay. This will be forwarded on to the full commission for acceptance since we meet tonight. Not enough time to get it, but it'll be on the full commission meeting for the December meeting. Anything else to come before the committee? Seeing none, we stand adjourned.